18.
-9.
-9.
-9.
And I will second
Thank you.
that.
Okay, we have a motion, we have a second on those items, minus number 2 and number 9. Kylie, did you pull the vote?
I didn't hear the second. I apologize.
I was second.
Okay, sorry about that. Supervisor Short,
Yes.
Supervisor Starkey,
Yes.
Chair Borges.
Yes. Okay, then we'll address item number 2 right now.
With
Supervisor
item
Starkey?
number 2, I had a slight concern, and that was that I just wasn't completely comfortable with in an amount not to exceed $25,000 per change order. It could be 5 change orders, 6 change orders. I'm hoping just to add in the language that we approve this as worded with not to exceed $25,000 per change order for a total of not to exceed $75,000 total.
Okay. Tony, you have any comments you'd like to add to that?
Good morning. Supervisor Starkey and I talked about this pretty much at length yesterday, and I'm fine with that. We're basically trying to stall because we're getting towards winter and time is of the essence, so we hope that we won't even need that much. So yes, adding that language is not a problem.
Okay.
So with that, I'll motion to approve number 2.
Kylie, was that clear to you what she was asking?
Yes, and we need to do a public comment on number 2 as well.
Yeah. So we have a motion,
And I'll second.
we have a second, and we'll do public comment on item number 2 of the consent agenda. Seeing none, I'll close public comment. Kylie, would you pull the vote?
Supervisor Short,
Yes.
Supervisor Starkey,
Yes.
Chair Borges.
Yes. And in that consent agenda was a proclamation declaring September 2025 as Recovery Awareness Month. And Supervisor Starkey, would you read that into the record?
Absolutely. And if you're here to receive the proclamation, you're more than welcome to come up to the podium. But I'll go ahead and start. The proclamation, pardon me? No. Thank you for joining us today. Appreciate that. The proclamation of Recovery Awareness Month for September 2025. Whereas the ability to locate, access, and receive treatment for substance abuse disorders is essential to the overall health and well-being of Del Norte County, producing healthier, safer, and more productive individuals within our county. And whereas in California, approximately 5.6 million residents aged 12 or older had a substance use disorder in the past year. Nationally, more than 105,000 Americans lost their lives to drug overdoses in 2023, and millions more experienced harms related to alcohol, stimulants, prescription medications, and polysubstance use. In 2023, an estimated 48.5 million Americans were living with a substance use disorder, also referred to as SUD, yet fewer than 1 in 5 received treatment. Whereas in Del Norte County, substance use remains one of the most pressing public health issues. Drug overdoses are the leading cause of premature death, nearly 5 times higher than the next leading cause. In 2023, the county's overdose death rate reached 90.3 per 100,000 residents, among the highest in California. That's tragic to me. Whereas the economic cost of untreated substance use disorders is staggering, estimating at nearly $1 trillion annually in the United States, and the human cost is even greater, seen in the loss of loved ones, the trauma experienced by families, and the ongoing challenges faced by children and communities. Whereas effective and life-saving treatments are available for substance use disorders, including medications, counseling, peer support, harm reduction services, and recovery housing. Yet stigma and discrimination remains powerful barriers that prevent many individuals and families from seeking or receiving help. Whereas recovery is possible. Each year, thousands of Californians enter recovery, and locally, the Del Norte County Department of Health and Human Services Behavioral Health Branch served 323 unique clients in its substance use disorder treatment program last year. Whereas the County of Del Norte observes Recovery Awareness Month each September to raise awareness of substance use disorders. celebrate the courage of individuals and families in recovery, reduce stigma, and promote community-wide support for prevention, treatment, and recovery services. Whereas we commend the Del Norte County Department of Health and Human Services Behavioral Health Branch, our local Behavioral Health Board, and all partner organizations, private, public, and faith-based, for their outstanding work in providing recovery resources, promoting prevention, and supporting individuals and families impacted by substance use disorders. Now therefore be it resolved that the Board of Supervisors of the County of Del Norte, that September 2025 is hereby proclaimed as Recovery Awareness Month throughout Del Norte County. We call upon our citizens, government agencies, public and private institutions, businesses, and schools to recommit to our community to increase awareness, reduce stigma, and ensure that recovery support and treatment services are accessible to all that need them. Passed and adopted this 9th day of September 2025.
I really look forward to some expansion of services that we're going to do in our recovery programs, and so I look forward to presenting those to you guys in the future and later today with our opioid plan too. Thanks.
Thank you so much. Okay, that'll take us down to our regular items for general government. Item number 24 on the agenda. Number one is, or part one is rescind the Del Norte County Board of Equalization local rules. And number two, approve and adopt the Del Norte County Assessment Appeals Board local rules as requested by County Council. County Council, do you have anything you'd like to add to this? Are you okay with taking questions if you have them?
Yeah, if there's any questions, I can answer them, but it's pretty straightforward. You have passed an ordinance creating the Assessment Appeals Board, and so we need to adopt rules that reflect that.
Okay, I'll open this up for public comment on item number 24. Do you have any? Seeing none, I'm going to close public comment.
This is just a simple name change. I'll go ahead and move we approve.
And I will second.
We have a motion, we have a second. Kylie?
Supervisor Starkey?
Yes.
Supervisor Short?
Yes.
Chair Borges?
Yes. Okay, item 25. Approve opioid litigation work group's recommendation regarding the implementation plan for use of the prescription opioid settlement funds awarded to Del Norte County for expansion of substance use services and other allowable prevention, education, and abatement activities. And number two, approve the transfer of the opioid settlement funds, which are currently located in a non-departmental budget, to the Department of Health and Human Services behavioral health budget under the same name. And number three, direct the behavioral health branch of DHHS to comply with all reporting requirements outlined in the settlement conditions and in accordance with the implementation plan as approved by the board.
Item 2. All right. So thank you for having us today to present the plan developed by the Opioid Settlement Work Group. I'm Cheyenne Hogan, the Deputy Director for Behavioral Health, and this is Jermaine Verbaker from RxSafe Del Norte. This slide just provides a brief overview of what we're going to be covering in our presentation today. As you can see, we're going to really start by reviewing the local impacts, reviewing our needs assessment, and finally presenting our plan and recommendation as presented today. This slide's just a reminder that the Board of Supervisors appointed each of the individuals on here as members of the opioid work group. And as you can tell, many of us were founding members or existing members of the Reaching Rural Initiative, which focused on strengthening substance use disorder treatment and supports in a rural community. We were tasked with assessing the needs, making a recommended community informed plan, and how we would allocate our opiate settlement dollars. This slide, just a quick highlight to you that currently we expect we're going to receive $1.5 million by the end of this fiscal year. Many of these settlements are still in litigation. More money could be potentially expected, and this is just our best kind of estimate of what this is going to look like. Next slide really just kind of looks at projected amounts. We really kind of conservatively project that we will receive about just over $4 million by 2038. And so the plan before you really focuses on what we know we have at this moment, but we'll present future plans as more money comes in each year to you.
Hi, everybody. I'm Jermaine Brubaker, the facilitator of ARC Safe Del Norte, the local opioid coalition. So as you can see here, the local impacts of opioids is undeniable in our community. In 2022, we were ranked number 1 in California for opioid-related deaths at a rate of 74.2 per 100,000 residents. That equals about 20 people who died of opioid overdose that year. And while we reduced in 2023, along with most of the rest of the country, we were starting to see a decline, but we were still at number 6 in the state. And that's still 11 people who died in 2023 in our community. And we're currently number 1 for emergency department-related visits related to opioids, which means although people are not dying, our death rates are declining, we're still seeing a lot of people overdosing in our community, but they're surviving. And you can see that Del Norte County is the blue line and California is the orange line, and we have been way above the state rate for quite a while. And we did have a little dip there, but we're way back up. So what should we do about it? So we went over this whole journey mapping project, and we wanted to make sure our funding decisions reflected the real experiences of people in Del Norte County. So we heard from 19 different individuals about what's working, what's missing, and what they need. And in addition to those individual interviews, we did targeted focus groups that were held with community partners, service providers, behavioral health, public health, child welfare, criminal justice system, tribal entities, and nonprofit organizations. From there, 9 themes emerged, and these are the voices that represent both the heart and the urgency of our proposal.
Catch up to my notes. All right. So the opiate settlement funds are regulated both by federal and state authorities. State law here in California requires that at least 50% of the funds be dedicated to high abatement activities. Those are issued by the Department of Healthcare Services, and they are outlined in our actual budget plan for people to reference and read. Allowable uses of the funding include a wide range of strategies such as prevention, early intervention, harm reduction, and treatment and recovery, all services aimed at reducing the impacts of the opioid crisis in our community. As outlined in our written plan, we are requesting that the funding be allocated to 4 primary categories. First is the project priorities. This includes establishing a dedicated coordinator to manage stakeholders, meetings, support groups, and planning. It also encompasses expanding treatment capacity, both locally in our county, out of county, as well as in our jail setting, while improving community access to low-barrier public health kiosks. Second is operating expenses. These cover essential items such as office supplies, stakeholder engagement meetings, expanded marketing and communication efforts, and enhanced access to medication-assisted treatment in the custody setting. The third is training and support. This really focuses on strengthening the capabilities of our local providers, our law enforcement, emergency personnel, and various community partners so that we're all better equipped to deal with the needs of our population. And finally, some infrastructure funds. This would give us a position to kind of leverage opportunities into the behavioral health continuum infrastructure money known as BCHIP, supporting kind of our long-term goal to expand access to care. And it's important to note, while what I'm reviewing is just a summary, more detailed explanation of each of these are in the plan on page 11. And then as outlined in the board report, we're requesting that you approve the budget plan as submitted. In addition, we're asking that the board approve the authorized transfer of the funds into the behavioral health budget and direct behavioral health to comply with all state reporting related to that. And thank you guys for your support, and we're here to answer any questions if you have any.
Great. Any initial questions from the board before I open for public comment? No? Great. I'll open up public comment.
Thank you.
Any public comment on this item?
So correct me if I'm wrong. We've thrown everything, well, we've thrown the kitchen sink at opioid dependency, and we're still experiencing problems. Now we're going to throw the whole kitchen at the problem, and we're expecting some sort of a difference in outcome. I hope so, sincerely hope so, because opioids pretty clearly is a problem in this community, and we aren't making much progress towards solving the problem. Thank you.
Morning, it's Alicia Williams. Sorry, I came in late, so I'm a little confused because I could have sworn the people that left said that there was a proclamation that happened, and that was number 7. And then now all of a sudden we're on this. But so I do have feedback regarding the plan. I read the plan that they put forth that they're asking you guys to approve. And that plan does not go over preventative, which is where we need to focus the efforts. What that plan does is it puts the money at treatment. So pharmaceutical people, the whole industry that created this mess with opioids, instead of putting the resources towards reducing prescription from our medical providers because they are not relying on the alternatives to opioids for pain management, which there are a bunch. I have a list. I went on CDC and I looked it up. There's all kinds of resources that are not even referred to in this plan that go into preventative, how to, again, stop the flow of opioids. There's 2 prongs to that, what I just mentioned. Reducing prescribing, which they're still prescribing really high. There was a recent article, I think it was Amanda something, I can't remember what her name was, and she referred to stats on it, and because there's different groups that do stats on that and say who's still prescribing a lot. We're still prescribing a lot in this county, so that's number 1. Number 2, we need to use the funding to reestablish the drug task force that the county used to have before it got defunded, so that we can reduce what's happening on the streets. So there's the legal opioid channeling that's happening, there's the illegal. That needs to be number 1 priority. And then support that is preventative support. So, finding out what the causes are for these uses. What are the causes? Lack of coping skills, okay? And that starts when you're young. Those things need to happen when they're young, to prevent when they're at the, like college level before because there's different levels to it. And then this part I really want to mention. So there was, in that same article that came out recently, the amount of harm is males that are housed that are in their 40s and 50s. Those are the ones that are affected the most by okay, that's not what you hear. You're always hearing it be about the people that are on the streets, and that's just not the case. It's actually housed males, white males, in their 40s and 50s. So this is a way larger problem, and it's not going to get fixed with naloxone, I believe is how you say it. That is a treatment. That is called a Band-Aid. So if we want to turn that flow off, you got to go to preventative, and you have to be really, really, really heavily focused with your resources on preventative. And again, law enforcement. We have to get law enforcement involved in preventative. Oh, and that was the other thing. DARE, back in the 90s, there used to be a program called DARE. Y'all remember DARE? So that was really great. And it works because you're able to have interface with people that are in that field. You're young, you're not intimidated because you're in a setting with a law enforcement that is positive, and they're getting the education that they need and the terminology and what is the repercussions from this, and you're doing it at an age that is really pivotal for some of this stuff. So the drug task force, reestablishing that with the money, that's huge. And then isn't Measure R supposed to also have funding with this sort of thing? So if this is like a limited amount of money that isn't going to be continual, then we can find out ways to use some of the Measure R funds to continue to support like the drug task force.
Thank you.
You're welcome.
Any other public comment? Seeing none, I'm going to close public comment, bring it back to the board for.
No, I'll just get a motion to approve as it was read into the record, item number 25.
I will second with a comment that there is a link to the California authorized uses for the funds here, the allowable expenditures, and I think this plan covers just about all of those allowed expenditures. There is no allowed use for reducing supply, which would be on the law enforcement side, which is, I agree, unfortunate. But as far as using these funds, how they are meant to be used, I believe this covers it. So with that, I'll second.
Okay, we have a motion, we have a second. Kylie?
Supervisor Short,
Yes.
Supervisor Starkey,
Yes.
Chair Borges.
Yes. And that takes us into our timed items. 10:25, public comment period. Members of the public may address the board on matters which are within this jurisdiction of the board. If you are addressing the board regarding a matter listed on the agenda, you may be asked to hold your comments till the board takes up that matter. Please limit your comments to 3 minutes or less. Any general public comment?
I came to the last board meeting and noticed that we're now going to start funding another failing JPA here in the county. I can't say that it's a surprise. It's been nearly 10 years since I've flown out of the Crescent City Airport, and I believe that was the beginning of the demise of what we now know a JPA that is a C in inability to meet FAA standards without, or mandates rather, without a significant amount of help from the county. I know the county owns the airport, the JPA, Border Coast Regional Airport Authority is supposed to be operating it. It currently cannot even fund its normal operational expenses. I don't know how it's going to fund the 5% matches on the 3 proposed projects that you addressed last meeting. There are 3 additional projects, probably amounting to somewhere in the neighborhood of $20 million. Not an insignificant fund, even at 5%. I don't know what you're going to do if you continue to support a joint powers authority that basically doesn't know what they're doing. I have some suggestions. I don't know whether you'll listen. The board itself didn't listen. I did get a comment by Supervisor Howard where he thinks that one of my suggestions might be appropriate. You need to get rid of the current at-large member. He's an impediment to any success the airport's ever going to have. You need to insist that the airport seek ways of lengthening the 2 airport runways by 500 feet. You need to see if they can attract a regional carrier that will service some place that the flying public wants to actually go. San Francisco SFO or LAX in Los Angeles. Hawthorne and Oakland isn't going to cut it. You're currently losing probably anywhere from 50 to 70% of your air passenger traffic because of the fact that they don't want to fly out of Crescent City and deal with the headache of that logistic nightmare. I would hope that because the county is going to probably end up with that JPA and all its indebtedness, that you would start looking towards the future to get something done out there that will actually work. Thank you.
Hello, my name's Anthony. I'm homeowner from Plymouth. I hear the gentleman's pain, and I hear the woman's pain as well, and her concerns about the opioid situation. But I'm not hearing the empathy. I'm not hearing the pain that is in the people that they're talking about. And until we get to that place where we can hear the pain that the people are in, there is no fix. You can't avoid pain. It's a dangerous planet. And so when people come in and say things like, are like 20, 30 years old in this process, for example, DARE, I dare to say it was a complete failure. And that's through hindsight. Hindsight gave us an awareness of what DARE was. It was a failure. And if somebody wants to bring that forward again, I think they need to get a little more insight, because we're all capable of some hindsight. We have potentials for insight. And this group that I've been working with has some foresight, right? And so that's what I think we are bringing here as a group and as a community and as a county, is some insights and some foresight. There's a whole bunch of hindsight. But I just want to say that the people are in place and we're ready. Thank you.
Thank you.
So I just brought up what Darren was referring to as far as like what's allowed to be the money to be spent on. So when you go on the list, it says under G, prevention programs, number 1, funding for media campaigns to prevent opioid use, similar to the FDA's real cost campaign to prevent youth from misusing tobacco. So that was an example. 2, funding for evidence-based prevention programs in schools. So that's like DARE. It doesn't have to be a failed one like DARE if you're saying it failed. It's something like that. It's a preventative program that is about educating youth. 3, funding for medical provider education and outreach regarding best prescribing practices for opioids consistent with 2016 CDC guidelines, including providers at hospitals, academic detailing. So that, I'm going to point out that we need to be focused on the alternatives to the pain management, which there's quite a few, and it has to do with lifestyle, it has to do with body, massage and different alternatives that are proven effective. It's on CDC website. I don't have it pulled up right now. Number 4, funding for community drug disposal programs. 5, funding and training for first responders to participate in pre-arrest diversion programs, post-overdose response teams, or similar strategies that connect at-risk individuals to behavioral health services and supports. So that's what's listed under G, prevention programs. So there are overlaps with law enforcement. It's undeniably, like, you cannot just compartmentalize everything. There's overlap there. So the funding can be spent on things like that, and we have to support that. And probation, they have a big part of it because they have a population there that we can actually help prevent from spiraling and getting worse. So that's what I'm advocating for, is that sort of stuff. If it's something that is specifically excluded, which I haven't found anything that says certain things are specifically excluded, then obviously you guys can't do that. But what I'm advocating for is preventative and to stop the flow of opioids from the overprescription, and that involves the medical community and a whole push there. And then the on-the-street stuff that's being ignored with the street populations, with the cartel presence, these things that are being ignored that we keep hearing about but we're not effectively addressing. This is an opportunity for us to address that better. That's what I'm advocating for. Thank you.
Thank you. Okay, if there's some more, come on down.
Okay. I just, I'm just thankful that you have Mr. Shamblin working on the Planning Commission. I wish we could find someone like that for the harbor. That's all I got to say.
Thank you.
Hello. Forgive my ignorance. Are we in public comment period? Okay, wonderful. I just wanted to take a moment to thank the board and the county employees and the community in part because to address like the encampment resolution stuff, we have been working together so well for 7 years to address the encampment solution and create a cross-county just system for everyone so that we can get everyone into housing who needs and wants housing. There's 7 principles to the encampment resolution, and I just wanted to remind everyone, establish a cross-agency multi-sector response, which we did a while ago and we continue to do. Engage encampment residents to develop solutions. Delnor Mission Possible is doing an amazing job doing that. I also sit on the continuum of care. The county is also doing an amazing job of that, and so I'm really, really grateful for everyone who is doing that. Conduct comprehensive and coordinated outreach. Again, Delnor Mission Possible and the county both are doing that. We've had a lot of success with our point-in-time count each year, and we've continued to see the numbers going up to accurately reflect what is happening in those homeless camps. It addresses the basic needs and provides storage. We've got our homeless shelter going up that's going to house at least 50 people in an emergency shelter, and we're working on that micro village to get 50 different units in for transitional housing, and we're still meeting to create more permanent supportive housing and just permanently affordable housing here in our county. It's really exciting. Ensure access to shelter and housing options. I kind of just covered that one. Develop pathways to permanent housing and supports. We're working on that. It's going to take some time, but to make sure that everyone has their human dignity in mind and have access to actually contribute to their community here in Del Norte County, which I believe most of them want to do, we're working on that. It might take some time, right? It's not an overnight solution. And create a plan for what will happen to encampment sites after closure. Again, we're working on that, and I think that we can continue to work together as a county to create something that actually works rather than just tossing people aside like they're rubbish. Thank you.
Thank you.
Good morning. My name is James Worley, and I'm a District 5 resident, though the issue I bring to you today is adversely impacting every district in Del Norte County, which is the emergence of what can only be described as improvised encampment districts. And my question is, what is it going to take to give these improvised encampment districts and the well-known subjects with mental health issues who populate them the 4th of July overhaul? Back in June, I requested the year-to-date records for the law enforcement, fire, and EMS responses to just 3 of these well-established camps scattered around the county that sit on various undeveloped county, private, and even school properties, as well as the records from code enforcement complaints pertaining to camp activity on these undeveloped lots to see if there were any trends or patterns that stood out. And after reviewing the results just last week, the results were unexpected to say the least. So far this year, law enforcement, fire, and EMS have already been required to respond over 250 times to just 3 of these well-known camps, and the bad news does not stop there. Code enforcement is also currently tracking at least 4 additional camps that they are unable to abate for various reasons, ranging from budget limitations to personal safety concerns due to hostile occupants. But in reality, there are at least 12 of these camps scattered across our county, with new ones popping up every week. To be clear, this is not an attack on the homeless community at large. I am very grateful to live in such a supportive and uplifting community, and I truly hope that everyone who wants and needs help is able to receive it. But this is an appeal to the greater good, because when 3 camps occupying less than a single square mile can generate 250 response calls, that's not an anomaly, it's a warning. And we have reached the point where the camps are being considered too hostile for code enforcement has become an objectively dangerous precedent in our county. So what can we do? Well, for starters, we have to stop looking away from a problem that's in plain sight. Many of these camps sit on private property, joyfully abusing the protections of the 4th Amendment to continue operating unchecked. Beyond the obvious need to ensure that our Sheriff's Department and code enforcement are sufficiently funded to function, the next logical step in addressing any problem is to identify the scope and scale of the issue. That's why I'm formally requesting that this issue be agendized so that community members can come in and share their experiences and suggestions, as well as you, the board, go out and personally interview residents, first responders, and frontline workers from the various departments to learn about their experience as it pertains to working around these camps and listen to their recommendations about how we can make improvements. With election season upon us, it would be nice to know that this issue is being appropriately prioritized by our elected officials. In closing, I'd like to thank you all for your time, and even though I'm a District 5 resident, I would warmly welcome a conversation with any of you on how we can work together to make our community a better place. Thank you for your time, and God bless.
Thank you.
Hello, Board. Stephen Jackson. I kind of want to piggyback off of Mr. Worley right there and really just speaking to this is not an attack on the homeless. And if anybody's been following the work that Mr. Worley's been putting in, it's mainly trying to figure out where we have a bottleneck in the system that anybody who goes and walks up and down the 101 can evidently see on a daily basis that there is a lot going on. There are so many good programs in Del Norte County. Like it was spoken on Mission Possible. It was spoken on, well, one of the votes I'll go on today is for the PATH director or whoever's going to be overseeing that position stuff. PATH is an amazing program that's all over. And when used effectively, it can stem the growth of a lot of these problems that we're seeing. The problem is I think the community at large doesn't even know these programs exist, how to access them. So I'm a business owner. I have a business right on the 101 corridor. I have called in multiple times for whether it be overdoses that are taking place in front of my business, people that I can only say or look like they're attempting to commit suicide by laying down in traffic as there's big rigs coming in their direction. Law enforcement responds every time. And usually it's 15, 20 minutes later and the issue at hand has been, removed, the person walks away, whatever the case may be, unable to locate. That's where we see it all the time. There's a page on Facebook that just goes over call logs for Crescent City, what's going on the scanner page. A lot of the times it's frequented by well-known subject with mental health issues. So that, I think, is where Mr. Worley's heart comes from with this is, how do we address that? I've had customers come in that love the beauty of our area, but say they don't know if they're going to come back because they see what's walking in front of my business. That sucks. There's no better way to put that. It's not without empathy. We want to be able to help these people. Honestly, there's probably 20 bad actors in this whole town that put a bad face for the entire homeless population. That's where the energy needs to go into. And there's already solutions that the state of California has brought forward for it. There's things like Prop 43 that says that substance abuse disorder is now considered a mental health case, and that a person, it could be a grave concern for their own health and safety, they can become conserved. Where then somebody, instead of being a voluntary inpatient somewhere, they could be deemed necessary to be able to go through these treatment processes. I'm not saying forced treatment is a good answer, but when nobody's willing to look out for themselves, the community needs to step in and be able to look out for somebody else. I have seen conservatorship actually do amazing things for people, and that's why it's a possibility that's out there. The care court, within our own Supreme Court system, that is an avenue to be able to go through. Yet, as a community at large, I've talked to a lot of people. Nobody's even heard of these pathways to supports that are going on there. So having maybe a town hall or something to educate the community at large, if there's a different way to access PATH than calling 911 or the non-emergency line, teach the community how to be able to go that route. But I think that, again, piggybacking off Mr. Worley for agendized items, would be to find a way for all this money that's going into teaching people how to access these systems. But thank you.
Thank you. Okay, if there's no more public comment, we're going to close public comment. And that will take us to our 10:30 timed item. Conduct a public hearing to provide the public an opportunity to hear and provide comment on the results of activities involved under Community Development Block Grants, CDBG, 21-CDBG-NH-20002 and 21-CDBG-NH-2003, and accept the final results through these grants as meeting the requirements of the grant and the various agreements between the county and subrecipients as requested by Administrative Programs Manager.
Good morning, thank you. This morning I'm here to conduct a public hearing, as Chair Borges mentioned. So the Community Development Block Grant Program is a federally funded program that the Department of Housing and Urban Development funds. The principal objective of CDBG is the development of viable communities, and as a non-entitlement jurisdiction, which means county of less than 200,000 people, we're eligible to apply. And we do so on an annual basis through what they call a Notice of Funding Availability, or NOFAs, which are generally released in January. Del Norte County has utilized CDBG funds over the years to improve community facilities and services, revitalize neighborhoods, expand affordable housing, and expand economic opportunities that benefit low to moderate income individuals. As a part of the public participation requirements, CDBG grants are required to conduct public hearings at several stages throughout the process, including design, which is when the NOFA is released, and then application comes back before the board to recommend an application be submitted, and then a closeout, which is why I'm here today. Notice of this public hearing was published in accordance with all of the requirements as in the public participation rules, which included posting of the public notice at the Flint Center Inside and Out, the triplicate in the Wednesday, August 27th edition, and our county Facebook page, as well as the Del Norte County Library. This public hearing is specific for closeout of 2 of our 2021 grants. In 2021, the county was awarded $500,000 to perform 2 public service activities. These activities included a children's advocacy program, which is operated by Casa of Del Norte, and the operation of a senior nutrition program, which is operated by the Del Norte Senior Center. Excuse me. During the performance period of both of these public services, the following accomplishments were acknowledged, or reported, excuse me. With the assistance of the CDBG funding, CASA was able to assist 169 children in our community. And the Del Norte Senior Center was able to provide healthy nutritional meals to 4,716 members of our 60 and older community. And that equates to 93,637 meals spread between congregate and home delivery. The money's going to a good cause for sure. The county received $34,884 to provide staff time, myself and admin, for grant management and subrecipient oversight, and that's generally from application to closeout. All services were provided within budget and within the timeframes established by the grant contracts with the state of California. This public hearing was conducted to provide the public an opportunity to hear the good things that this money was used for, an update on the results of the activities and surrounding these grants, showing that they met the requirements of the grant, and to obtain board approval to accept the results. Also here today we have Charlene Mazie from the Del Norte Senior Center, as well as Christine Sleddy from Casa of Del Norte. Should you have, they'd like to make a comment about the program as well, and just let me know if you guys have any questions of me.
I just want to say thank you, Tony, for the management of these huge grant and the work that goes into it. I mean, it doesn't go unnoticed, your role in it.
Thank you. And I guess I'd invite you guys down if you'd like to add anything to that before we open it.
Good morning. So my name is Charlene Mazie. I wear a lot of hats in this community, but today I'm here as the Executive Director of the Del Norte Senior Center. And I just want to say how much I appreciate that the county has included us in these applications for a number of years now. Without this money, it would be very difficult for us to continue to operate the senior nutrition program. You heard how many people we serve, how many meals we serve. We also have been experiencing inflation. Our staff costs have gone up, our fuel costs have gone up, our food costs have gone up. We're currently running a program that costs roughly $600,000 a year. We do receive funding through the Area 1 Agency on Aging from Title III of the Older Americans Act. That funds a half, maybe a little less than half of what it actually costs to run the program. So where we are constantly having to look for the other half, and the CDBG has been essential to us being able to find that other half. So I just wanted to put a couple faces on what we do. I have a couple letters from participants. These are folks that get home delivered meals. We do deliver from Klamath. Once a week, we deliver frozen meals to some participants in Klamath all the way up to Smith River. We have a daily route that goes to Smith River and then everywhere kind of in the greater Crescent City area. So this is, we got these letters when we were seeking funding when CDBG was delayed. So this is, to whom it may concern, I understand there's a possibility you will discontinue the Daily Meals on Wheels program to senior citizens in Del Norte County. I'm extremely sad to hear this, and I urge you to reconsider. My 90-year-old mother, Mary Lou Saunier, who lives in Ocean View Drive in Smith River, has been receiving meals for the past year and a half. She is homebound and looks forward to chatting with Jerry each day, who's the driver. Like most of the seniors you deliver to, Mom has come to rely on these meals and appreciates the consistent daily delivery of quality food you provide. I live out of the area, and it has been a comfort to me to know that Mom is getting both a daily social interaction and a nutritious meal. Please do not eliminate this vital service. I had another letter, but I don't know what happened to it. Did I drop it? There it is. Okay.
All right.
Thank you. This is another one I'm writing to thank you for the Meals on Wheels program. I have received this wonderful service for a couple of years, and it has been such a blessing. I am 78 years old and very limited in my movements due to crippling arthritis. I'm not able to stand at a stove, cannot lift pans filled with water or hot foods. This has been a problem for 10 plus years, and each year I am more incapacitated by this problem. Having the meals delivered has made all the difference getting good, healthy meals. The savings on groceries and the help with obtaining the groceries, I cannot walk well for grocery shopping. I truly do not know what I would do if the program were to end. I also live on Social Security, and the savings cannot be measured. Inflation of food products is a very real problem. I can also say that I have an older lady who lives in my spare bedroom who lives on Social Security. Her home and belongings were destroyed in the Paradise Fire a few years ago. She has nothing and no place to go. It has been a miracle for her to receive her meals each day. Together, we have found a way to survive and still stay at home. I have no idea where either of us would go without programs such as this. So this makes a huge difference. It's impressive to talk about the stats, but these are the real people that we're helping. And so your help with including us in these grants and our ability to use the money is really life-saving, literally. So if you have any questions, I'd be happy to answer.
My question, it might be for Ms. Self or you, we're closing out one aspect of this. Is there more CBDG funds coming on the horizon? Because 4,700 people with the last 3 years that received this nutrition program is important in our community. Would we close this out? Are we looking that there's going to be additional funding to keep this going?
As I mentioned, the CDBG program generally has pots of money that are offered in a notice of funding availability on an annual basis in January. We are currently, we have a conditional award for 2024 funding.
Okay.
So there will be additional funding coming.
But now it's going to be annual. This was a 3-year funding, correct?
The grants themselves are 36 months.
Okay.
The senior center, because of the rising cost of food, the number of people they're feeding, they go through their money a lot faster than the 36 months.
Okay.
So once we spend out 50% of our grants, generally we can reapply.
Okay, thank you.
Thank you.
All right, thank you.
Good morning. So you all are really aware of the CASA program, but just for the public, the staff with CASA recruits, trains, and supervise volunteers in the community to advocate for children in the child welfare system. And this is a very overburdened system. And so, having volunteers assigned to these cases is absolutely a necessity for these children. The volunteers go through a training with CASA, and then they get sworn in as an officer of the court, and then they get appointed to their own case, which is typically a child or a couple children. We have some volunteer advocates who work in partnership with other CASA sometimes on a case, which is kind of cool. But most importantly, the volunteer advocates, it's important to know that when she's mentioning how many cases there are, some of these advocates have been on their cases for more than 2 years, because a typical case lasts over 2 years. We've had CASAs who have been on a case for 10 years plus, and have really stayed there and been that really important person, positive person for the child. So the CASA not only gets to know the child, but they review medical records, they do medical advocacy, they make sure they're getting their mental health needs met, they help support placement security, and most importantly, CASA is taking a really strong position on family search and engagement efforts so that kids are not lingering in the foster care system. I feel really blessed. I've been doing this job for over 18 years now, and I get to work with some of the most selfless people in our community who are volunteers. The CASA program, we have 4 staff right now due to state funding, but CDBG funds are vital. The Judicial Council calls for a CASA to be assigned to every case, but there's no secure funding for that. There's no possible way that we could raise the funds in Del Norte County to do the work that we're doing, so we need to rely on these CDBG funds to keep our program going. And so the CASAs are vital in ensuring that these kids' needs are getting met while they're in care. And in addition to that, they often become a friend, a positive person in their life, which reduces adverse childhood experiences. So I just want to thank you all for continuing to support CASA with the CDBG funding. And in addition, you guys are always supporting CASA out in the community with your services, and it's vital to our community. CASA also is a partner with the Child Abuse Prevention Council. We do a lot of work with them. And we also, CASA is the lead agency with Resilient Donato, who's doing a lot of work in the community to build resiliency in Del Norte County. We've been getting funded from the California Endowment for that work, and Amber Weir's been leading the work. What's really exciting is that as I was listening to some of the folks bring up their concerns in our community, Resilient Donato has been working on trying to do neighborhood barbecues and educating the community with mental health and getting to know each other. And so there's some of that work that is actually getting done in Del Norte County, and maybe Resilient Donato can come in and share that information at a future board member meeting. So do you guys have any questions?
Yeah,
for
Christine,
me?
how many kids are under the jurisdiction of the court, and how many are being served by a CASA?
So CASA, we come into the court system and we monitor all the cases, and so we're only aware of the cases that we're sitting in and monitoring. So there's 2 sets of cases. There's the dependency cases and the delinquency cases, and our system shows that there are approximately 100 cases or so. I think they're over this period of time. It might be 80 to 100 cases. But over this period of this last grant, there was 183 cases that went through the system, and CASA was able to serve close to 30% of those children. Our goal would be to serve every single child. So if we had enough volunteers step forward, we could put a CASA on every single case that came under the jurisdiction of the court, because that's what Judicial Council is calling for. So we have a great need for more volunteers, definitely.
Thank you.
And Christine, I just want to say that my time being a CASA before I was on the Board of Supervisors was really one of the most rewarding volunteer jobs I've ever done. And so just to make another pitch for people that may want to volunteer to be a CASA, you become just an integral part of these young people's lives. You know, with me and my CASA, we would go to the beach or paint rocks or just read stories. Right when she was first placed in her foster home, she had a real hard time adjusting. So I was able to bring over my collection of stickers, which it's enormous, and that really just helped. And so I'm hoping that there'll be some volunteers out there that want to just have that compassion attachment to a child in need at this time. And it doesn't take a huge amount of work. It's just being there for that child. So thank you for the work that you do.
You're welcome. Thank you.
Thank you.
Anyone?
Okay, at this time, I'll open it for public comment.
Just a quick question of the program manager. Sounds like you're doing a lot with nutrition, but it seemed like I heard something about an affordable housing component with regards to the funding, and I was curious as to whether that is occurring or whether or not there.
In previous years, there's been funding.
But there's nothing now.
Not in this, these are public services.
Thank
So
you.
that's what the funding.
So, you're not considering, is there a consideration to put this on the chopping block, or you just want the public to know? Is that what it's all about? To know
Not from the
about
not from the
programs.
county. It's from,
The
it's
county.
coming down from the feds on whether or not the program's viable.
We're
So-
just here saying it did what it's supposed to. We're proud of the work that was
Yep.
done. and
Yeah,
we're
but you
approving
guys
it.
are still going to get the money, right, for these services?
That's what we're hoping for. And
Yes.
Oh, for
this-
God's sakes.
We continue to apply.
I got an
continue to
idea. I got an idea. So we just delete the airport and use that money for.
Thank you.
So, hi, I do have a couple questions because it's a little bit confusing. So, CASA is volunteer advocates, and then the training is provided, and she said they have 4 staff currently. So, I guess the funding is to pay for the staff because the rest is volunteers. And then there was no mention of how many volunteers they currently have. And then I would suggest for volunteers, the veterans, they're a really underutilized resource in this community. They also need to find other ways to be involved in the community to kind of reintegrate. And I've been trying to advocate for ways they can do that, like maybe with helping with literacy and things like that. That's pretty much falling on deaf ears. But I'm going to continue to mention that demographic. They have a lot of great experience that we're just not utilizing. And then they're being isolated, and this can bring them out of isolation. It's just, I feel like we really need to focus on that. And then I'm wondering about the conversion with seniors, because the seniors and retired people, that's a huge area for volunteers. And so we've got the senior center person here, and we've got CASA here. I feel like they should be kind of merging together to have volunteers maybe from both directions on the CASA end. I mean, some seniors obviously are healthy and some aren't. So the ones that are healthy enough to volunteer, maybe that would help. But I am confused about how much money is going to fund CASA when it's primarily volunteer advocates. That part's a little bit confused. Oh, and then for the Meals on Wheels, what about SNAP? I mean, isn't there, I know we put a lot of money in, free food, and then we have a lot of food banks in this community. That's one of the things that I'm finding that is a resource here that's overabundant, which is free food. So I feel like maybe there needs to be more collaboration there to make sure, like, if there were funding gaps for these populations, that they would still get their needs met. So that's what I have to say. Thanks.
Okay, seeing no other public comment, I'll close public comment and bring it back to the board.
I want to just say, again, thank you for all of you for the work that you're doing for this community. And Tony, thank you for the work that you do in handling that grant. Do we need to do anything formal, or is this just the public hearing? Do we need to have, we're accepting?
that.
So I motion to approve that we accept the final results through these grants as meeting the requirements of the grant and the various agreements between the county and the subrecipients as requested by the county administrative programs manager.
I'll second.
We have a motion, we have a second. Kylie?
Supervisor Short,
Yes.
Supervisor Starkey.
Yes.
Chair Borges.
Yes. Okay, again, thank you. Okay, item 21, timed item, 10:45, timed item. Number 1, open public hearing for the 2025-2026 fiscal year final recommended budget as amended and all special districts budgets governed by the Del Norte County as submitted, and continue the hearing for 14 days. Item number 2, approve the use of county general funds for the operational budget of the Veterans Cemetery. And number 3, accept the recommended children's budget as presented, attachment A, as requested by the county administrative officer and county auditor controller. Anything to add, or should I open public comment?
I just want to say that for me, having those budget workshops really helped us guide this budget and get it to where it is. There's a few things that I'm still questioning that I'll, over the next couple of weeks, talk with the budget team about. Once in particular is the public defender's budget, is that we're still budgeting for a full-time position, yet we didn't deduct from the contracted employees. Might be a minor thing, but as we're going to hear here in a moment about the compensation analysis, we're going to have to start being very picky and looking for where we can get our employees up to where they need to be. So we're going to have to really look at the weeds of this budget. But with that said, I really feel the budget workshop really helped us flesh out a lot of what our concerns as the board. We really helped guide where we wanted this to go. There's always going to be work to do, but I appreciate the budget team. I appreciate this balanced budget here before us today. But we can make some cuts in various places to be able to provide better services in other areas that I'm hoping that we can accomplish over the years.
Yeah, thank you, Supervisor Starkey. I ditto that about the hearings. I learned quite a bit with that. I know we haven't opened public comment yet, but I will move we approve the use of the county general funds for operational budget of the Veterans Cemetery, accept the recommended children's budget as presented, and that's it.
And I will second that.
Okay, we have a motion, we have a second, and I'll open it for public comment. Public comment on item 21, opening the public hearing for the fiscal year budget.
I just wanted to ask a question because there is no data on this, and I guess this is pertaining to something that you guys said you had budget hearings about, but I don't know anything about it. So, I mean, is there any way you guys could characterize what these are? What is the children's budget and what is the operational budget for the cemetery? Please.
The budget workshops are on YouTube. You can certainly go back and watch those and that discussion that took place there.
Okay, seeing no other public comment, I'll close it. We have a motion, we have a second. Bring it back, Kylie?
Supervisor Starkey?
Yes.
Supervisor Short?
Yes.
Chair Borges?
Yes. Okay, our 11 a.m. timed item, number 22. And it is number 1, receive a compensation study overview presented by Gallagher, and number 2, board to receive and file Gallagher's final report. Okay, welcome. Can you guys hear us?
Yes, good morning.
Good morning, you're on.
Okay.
Good morning, testing my audio as well.
Perfect. Okay, we are ready for you.
All right. Okay, I wasn't sure if there was going to be an intro or what. So thank you all so much for having us today. My name is Carrie Mercer. I'm a senior consultant with Gallagher. I'm joined by Georg Kramer, our managing director. And today we're going to be going over just a high-level sort of flyover of our results and the methodology for the study and giving the opportunity for questions as well. I'm going to go ahead and share my screen. And are you all able to see that okay?
Yes.
All right. All right, Georg, you want to go ahead and take these first few slides?
Yes, thank you, Carrie. Good morning, board members. Pleasure to be here, and pleased to present to you the kind of the methodology and process and findings of our compensation study we did for the county. You can probably jump to the next slide, Carrie, but the agenda for today is to just give you an overview of our methodology. Like Carrie said, we'll keep it sort of high level. We'll get right to the study results and recommendations as part of our presentation. And just sort of as an introductory note regarding how we go about doing compensation studies like this, there are 3 main survey elements that require quite a bit of discussion and deliberation and analysis to ensure that the study will result in significant number of data points and a validated sample of data. And that is number one, probably the most important decision and analysis is to determine the county's labor market and which agencies are comparable agencies that are similar to the county in a variety of different factors. And actually, Carrie will talk about that in a little bit more detail. So essentially determining who the competition may be and what other agencies are similar to the county of Del Norte. The second element requires analysis is to determine which jobs we're going to survey. Our typical approach is not to survey every single job, or we call them job classifications. Not every single job classification, but to go through a benchmarking process where we typically select about 60 to 65% of all of the county's job classifications as benchmarks. And benchmarks essentially means those are the jobs we went out to the market to survey within the market and obtain market data. And that market data for those benchmark classifications creates the anchor we use to anchor the county's compensation plan to the market. And then finally, the third element was to determine, in addition to base salaries, which benefit elements we were going to gather information on. This being a total compensation study, there were several benefit elements that we looked at, such as retirement, insurance plans, paid time off, and things of that nature. So with that introduction, I'll turn it back over to Carrie.
All right, thank you. So as Georg mentioned, one of the more critical aspects of this is to determine which comparator agencies will be using as the labor market. What we did is we started with a larger list of agencies than the number that we ultimately were going to land on, which was 8. So we started with a larger list and looked at things like organizational type and structure, the population served in terms of the size of the population served, number of employees and expenditures, services and programs that are staffed by the county, geographic proximity, and cost of living. And so that kind of formed an overall agency profile for each of the potential comparator agencies. And then we compared that to the counties to determine those that are most like the county versus those that are less like the county, really with the purpose being twofold. One being identifying agencies that are relevant in terms of competition for qualified staff, as well as establishing those that are more likely to yield sufficient data for each of the benchmark classifications. So based on that analysis, we arrived at these 8 counties that you see on your screen. That's Amador, Glenn, Humboldt, Inyo, Lake, Mariposa, Plumas, and Siskiyou. So from there, we looked at our compensation elements and determined which of those would be rounding out that total compensation calculation. So of course, the monthly salary is a part of that. We also looked at retirement, which included the PEPR tier of PERS, as well as agency paid Social Security benefits. We collected agency paid deferred compensation benefits for each of the employee groups. Agency paid insurance premiums, which included health, dental, and vision. And then we looked at paid time off, which included vacation, administrative or management leave, as well as holidays. So our data collection includes a wide variety of methods, if you will. We first start looking at those job descriptions or classification descriptions. We're making a description to description comparison with the county's descriptions for each of the benchmark classifications, establishing which of those classes match or are comparable to that of the county. We're looking for a 70% threshold, which is really what we're saying is we're looking for a preponderance of the classification within the comparator agency to be a match, understanding that we are not likely to find a 100% match. There are going to be differences in some of the more peripheral duties performed by some classifications just based on differences in the way that the agencies are structured and organized. So we're looking for a preponderance of that classification to be a match. We're also looking at MOUs, organizational charts. We'll look at budget documents, salary schedules, and so we're gathering information from all of these documents that are available from the agencies, and then doing follow-up with those agencies as needed. So if there is ambiguous information in some of their MOUs or the class descriptions aren't clear, if we need to confirm or verify that we've got the most recent and up-to-date information, whatever that may be, whatever gaps in information might be there, we conduct that follow-up just to ensure that we are presenting the most up-to-date information at the time of the study and that we're having any of our questions answered as part of our quality control process before we even get that data over to the county in the first place. So from that data collection process, we established for the benchmark classifications that overall the county is 10% below the market median. You can see here that that ranges anywhere from one of your classifications, one of your benchmarks being 14.5% above market, and then one of your classifications being 36.6% below median, and then the rest of those benchmarks somewhere in the middle there. You can see that based on base salary, we have 31 of those benchmarks being within 5% of the market median, which we would consider anywhere within 5%, meaning 5% below or 5% above, to be generally competitive. And so we kind of take a look at how that looks for the county versus those that are more on the periphery, being farther away from median on either side. So you have 31 of your benchmark classes that were within 5% of that base salary median. When we look at total compensation, the county is actually 2.1% above median. So that means you're roughly 12% more competitive in the market when considering total compensation versus when considering base salary. Your range was 23.1% above. So one of your benchmarks was about 23% above market. And you had another one of your benchmarks at almost 24% below median for total comp, again, with the rest of those benchmark classifications falling somewhere in between there. And for total compensation, you have 43 of your benchmark classes that fell within that 5% threshold. The county ultimately determined to use base salary as a point of comparison. We often will advise clients that the option is to use the point of comparison where the county is more competitive. The county did determine that salaries really needed to have attention paid to them, and so opted to look at the base salary results for the comparison point. And so as we looked at that, you do have around 45% of your your benchmark classifications that are below market. You have just over 5% that are above. We did have about between 25 and 30% of the benchmark classes where we had insufficient data. That isn't uncommon for us to find classes that have insufficient data. And for that reason, Georg mentioned earlier that we use between 60 and 65% for benchmarks. That actually is a very, very high percentage for benchmarking in any kind of market study. We are very aggressive with the percentage of benchmarks that we use, because we anticipate that there are going to be a number of them that we don't find sufficient data for, because the bodies of work are performed in some different way in those other agencies than the way that they're performed in the county, such that we can't match them. So we selected a large number of your classifications for benchmarks to be able to account for the fact that we anticipated finding insufficient data for some. And again, we have close to about 20% of your classifications being within either 5% above or 5% above that, below that market median, rather. So market position, as we looked at the data and made that comparison and provided the statistical analysis, we did look at that market median. And again, 5% within the median is generally considered competitive. As you consider what this data means and how to implement it and what next steps might look like, those classifications that are more below market median would be where we would recommend that you start looking first. Those obviously are going to represent more vulnerability or opportunity for turnover farther from the market. And so generally we would recommend that we take a look at that first. And as we'll talk about in the next slide, there might be another point other than market median that the county ultimately determines. to use. So the market data does provide a reference point to give you a sense of where you are sitting in terms of your external competitiveness. Determining the compensation philosophy is an important aspect of this. As I mentioned, the data is presented looking at market median. The county may ultimately determine that another data point will need to be considered just based on fiscal feasibility and fiscal realities. So it might be that there's a median minus X percent, a median minus 5, or a median minus 10% that you ultimately determine is going to be most feasible for you to use moving forward. The next step would be designing that compensation structure once you've really landed on that, whether it will be median or median minus a percentage. Currently, the county does use 3 different structures. There's a 5, 6, and 8-step structure, respectively. Each of the structures has 5% between steps and 2.5% between ranges. As we looked at developing those internal relationships and making range placement recommendations, the differences in the step numbers and sort of having a less structured format for your compensation structures than what we typically encounter did pose some challenges when we looked at implementing and trying to use that market data for making those recommendations. There were a number of internal relationships that there was some significant overlap in the salaries because of some classes being on an 8-step and some classes being on a 5-step. We use the maximum salary for comparison purposes and for establishing those internal relationships, whereas the county has historically used that entry step instead, which is where we ended up with some of that salary inversion. So some challenges, again, just with using or applying that market data. Once the sort of the structures are established and you're moving forward with that, again, after deciding on your comp philosophy, it'll be placing those job classes within a structure. Again, those internal relationships may dictate overriding market data, and for many of the classifications that might be required, again, because of those different structures and sort of the nuances and anomalies that created. We did make recommendations on how to establish the relationships, where we would place with respect to one another, where we would place those classifications. Actually determining the ranges will be something that the county does moving forward. And then determining actual employee pay. So once those ranges are established, determining where each employee actually lands within that new structure will be sort of that next step. And then from there, continued maintenance and administration. One of the things that I did touch on in the report is that with the county potentially considering a multi-year implementation, the market can change over time if the implementation is more of a protracted, 3 to 5 or more years. And so part of that continued maintenance and administration will be sort of aging that data to ensure that you're comparing to market data that continues to be accurate and relevant. And so also provided some information on how the county might want to do that in moving forward as you implement. And that's all we had covered. As we said, we wanted to kind of make this brief and give an opportunity to ask questions. So happy to take those questions now.
Okay, thank you for that. I'm actually going to open up public comment, and then we'll bring it back to the board for further questions, if that's okay. Come on down.
Good morning. Please don't take this as personal or me being mean, because I'm not mean. I can be mean, but I'm not mean. I'm just thinking that presentation that you just gave said absolutely nothing to the public. We all sat here and scrolled on our phones, and I'm sorry, but I think you should break it down a little bit better so the public understands what you're saying. And I apologize, but I got absolutely nothing from this. Thank you.
Sorry. I swear it'll be fast. Hi, so I can help her out. So the the takeaways from what she said was that 10% below, we're 10% below on compensation only, like salary without benefits, in 45% of the listings. And then overall with benefits, we're 2% above overall. So that means we are considered competitive. Ta-da.
Norma Williams, Delaware County Employees Association, SEIU 10-1. I have one word on that comment in terms of us being competitive, but it's in Spanish and it would translate the same in English, and I'm going to try to keep it clean. Well, it's finally here. Long time in coming. But suffice to say, what's been presented is nothing new to SEIU. In fact, based on our own compensation analysis starting in November of last year, based on our own comparator analysis, looking at past compensation studies on some of the comparator counties, even looking at some of the past Goff and Associates compensation studies. That's what Gallagher used to be, Goff and Associates, taking a look at what they did in terms of their compensation studies and even other compensation studies. It's nothing new. It's what we've been telling you for months. At this time, the union will fully respond to this presentation within the 10 minutes given to us at the end of the next agenda item, since the two go hand in hand. 3 minutes is just simply not enough time for the union to adequately respond to this presentation. In the meantime, we can only sum up what we think about this report in 4 words. We told you so. Thank you.
I guess I'm somewhat confused. It seems like you were talking about a compensation study, 8, 9 months ago, and the compensation study was to be completed in, February, March of this current year, and this is the study that we're looking at now, and I'm somewhat confused when they're saying that you're competitive employee-wise with comparative areas in the state, and yet you have an appalling vacancy rate, and you have a severe difficulty in retaining employees. How can you possibly be competitive if you're facing that kind of a scenario? It doesn't compute. I mean, how can you have a study that basically is completely opposite of what you're experiencing here in the county with regards to how you're handling your employees? I'm sorry to use the term handling, but that clearly, in my perspective, seems to be what you're doing. You're not treating them as valued assets for the county, and you're instead handling them with comparative studies that don't really accurately reflect your scenario here. I'm at a loss as to what you're doing here. You pretty clearly need to change your approach to how you're addressing your severe lack of employees and their I suppose their feelings towards how you treat them with regards to being able to keep them employed here in Delaware County. Thank you.
That's it, sorry. No, I'm sorry. That was it. Is there any other public comment? Okay.
So thank you, Carrie. and I'm sorry, I'm forgetting your name. But to some of the concerns that I have, well, I want to make a couple comments. In reviewing this report, I think it's very clear that Del Norte County provides a very generous benefit package. I think that our benefits, if you were to compare the salaries and just alone with the overall package, I think that we're looking that we have a very good benefit package. I want the employees to know that when it was brought forward to us as a board, what we wanted to look at. Do we want to look at the overall compensation or just the salaries alone? This board unanimously decided to look at salaries because that's what's money in your pockets. That's what we felt was most important and what we've been hearing from you time and time again, that it's about money in your pockets at the end of the day for the work that you put in for our county. And we heard you, and that's why we are here today looking at just the salary, the base salaries alone. We've got quite a few positions that are, 25, 30% out, and we have some that are slightly over, some that are right in within market. Now, the real work is now going to begin for this county to decide how are we going to address this. I'm not the only voice, but my voice is going to be that we fix the problem. We fix the problem at the front end. We fix it now. And that may look like something that is not acceptable to some of the people that are within market range. But we've got to get to a base level. We've got to get to a starting point. Part of what I'm hearing you say, Carrie, is that because we have these different bargaining groups with all these different ranges, some A to E, some A to H, that really made it difficult for you to come up with one specific data point. And I'm just going to be honest, when I looked at this report, the thing I was most excited for in this overall analysis was that we would have this really detailed structural analysis of the structure of our county. And I don't see that in here. I think it really does fall short on that. And this morning, even I was talking with a colleague, and I said, I'm disappointed in that. And they said, oh, no, that's still coming. And that's nothing more is coming. So I'm very disappointed that we don't have that structural analysis for us to then be able to have that starting point going forward. And from what I'm hearing you say, and please correct me if I'm wrong, is that because we have those different ranges within our various bargaining groups, that's the reason why we couldn't come up with a structural analysis?
The structural analysis was conducted and we provided the relationship recommendations. The actual range placements, because you do have different structures for different groups, the range placements created some overlap in the pay between individuals who are in, say, a director or management role versus those that are in their reporting structure, their direct reports, such that even in some cases, there may be salary inversion for a number of years as employees work through their respective structure. And our recommendation and our practice is to compare maximum salary to maximum salary, both when we're making our data collection and looking at external competitiveness, as well as when we're looking at those internal relationships, because that really represents the overall value of that body of work, or how that body of work is being valued within the agency, understanding that there's differences in the way that employees may reach that because of the structural differences. So what resulted, again, was a significant amount of overlap between some of those classifications. The county has historically used an entry step comparison for establishing internal relationships. That does, from what we observed, pose some problem with the application of the market data for those classes then, because the market is saying that it's, that body of work is worth X. And if you compare at the bottom step and use those internal relationships to sort of build from, you end up with some those classifications that don't quite get there to that market
But
placement.
doesn't the
I'm sorry.
market data all have a bottom? Doesn't the market data show an entry-level position for every single position that you're analyzing? Couldn't you compare your entry level with your entry level for the market data?
We did not collect the entry level. We make the comparison for maximum to maximum, again, because there can be differences in structures and the difference in the way that that maximum gets reached. So that is a compensation best practice to use that maximum step to normalize for differences in salary structures that exist across agencies. From one agency to the next, the mechanism by which the maximum is reached may look different. We often find also that the entry step can be overridden, I guess, in a lot of agencies where there's advanced step placement and those kinds of mechanisms and practices, particularly as you get into those classifications that represent someone who's been in their role for longer or in their career for longer, such that those entry steps become less and less relevant. And so again, for a number of reasons, that maximum step is that maximum salary that's the data point to compare both externally and internally from a best practice approach.
Okay. All right, thank you.
If you don't mind me jumping in. I guess I'm confused too, Carrie, that, I mean, I hear what you're saying about the entry step, but it all translates. I mean, yes, we may not be paying the employees at base or at the bottom step right now, but it would at least be a constant. I mean, I'm looking back to your presentation on that second to last slide. You took quite a number of minutes to explain to us how there was problems with your methodology and how there was overlap. And it seems like it was because we have multiple structures with, like you said, 4, 5, and 8 steps. Why wouldn't you use a step that was consistent across all of them, like one of the first 4 steps? If you don't like using the bottom step, why wouldn't you use B or C or D? Then at least your control point would be consistent. And wouldn't that have fixed the problem?
So using that method results in one of two things. It results in one group, the recommendations, the maximum salary being over market, in some cases by 15%, or it results in the other groups being placed in a range where the maximum salary is below market. We could not achieve the market, what the market valued or how the market valued those classifications by using a control point within the structure. We couldn't achieve market median for all groups. One was going to be over or one was going to be below.
If you use the same control point for all of the other counties that you evaluated, it would have made us over or below. I'm thoroughly confused with that. If you use the same control point in your evaluation, why would that skew the information?
Well, for external comparison, we did use a control point, which was the maximum salary for each classification.
But that's not a consistent control point, though.
That is the most accurate method for comparing how that body of work is valued in the market.
How can you be accurate if your control points are not consistent? If you're not using the same control point, your maximum on an 8 step is far different than your maximum on a 4 or 5 step. I don't understand how you could get an accurate data set that way.
I could maybe jump in and maybe clarify that, we're talking about sort of, in my mind, we're talking about 2 separate aspects of the study. One is the comparison to the external market, and that's where we use maximum salaries because that is the most reliable data point that is consistent throughout all of the agencies that we survey. The other piece we're talking about is, and so this helps you achieve what we call external equity, which essentially means being able to pay a competitive wage. The other piece, which is separate from the market study, is looking at internal relationships, and we sometimes call it internal equity when we look at relationships between jobs, especially those jobs in the same job family or career ladder that should have clear relationships to each other. And those internal relationships is what Carrie was talking about, is where the challenge came in for us to recommend typical relationships of, let's say, 10, 15, 20% when we're looking at a top step and building down from there, because in some cases, the ranges have 5 steps, and in other cases, the ranges have 8 steps. And that's what the current county structure is. So the challenge we're talking about really comes from looking internally within the organization to try to establish those internal relationships.
I'm sorry, that didn't really help me. If we have a department head or assistant or appointed department head that has the, because of their position, has the ability to go 3 steps higher than the people that work underneath them, it seems like it's easy to understand how that would skew your internal relationships if you're basing it off of that top step. You have to use a consistent step. Why wouldn't you use one that would be the same? I'm confused, and I guess would move on. It seems very simple that you could have used the bottom step. I mean, you're telling us that that's not the way it's done, but it seems like if you use the entry level step, you could translate up in the ranges and steps all you wanted to make it work for your top steps, and no matter what your structure is. But also, I wanted to just kind of also say I'm really disappointed that we don't have that real structural analysis like Supervisor Starkey was saying. I was hoping to be able to look at our whole county like I don't know what you want to say is look at the structure and how the hierarchy is and our number of employees and how that's working and relatable to others, just to see where we sat. And I didn't get that, and kind of thought that was, I mean, that's the biggest part that I was looking forward to in this study, and it's disappointing that we didn't get that. And just to wrap it up for me, I'll have to say that having used those inconsistent data points and now having this overlap in our hierarchy is going to make it really difficult for the board to go forward with our bargaining groups. I think collectively all the board is kind of right along pace with Supervisor Starkey that we want to get this fixed. But if we have a data point that's telling us that there is an employee that's severely underpaid, but they overlap the supervisor above them, then how can we do that? It's going to make it very difficult for the board to just across the board fix it, and it seems like the county administration is going to have to do a lot of work to redo the work, I guess, that they've been given here. So that's all I had.
It was the structural part was a part of this. Is that correct?
It was, and we did make recommendations on how to structure those internal relationships. So we have given you a detailed map on how those relationships within job families should be formed. When the range numbers were assigned based on those relationships is where we observed that the internal relationships become overlapped. And so the actual range numbers were ultimately not assigned but the structural analysis and how to establish those relationships has been provided.
Okay.
Well, I have a specific question, if you don't mind, Carrie. If you look at where you're saying the structural analysis did take place, you have, and I'm just randomly picking something, please nobody feel like I'm picking on this, but the Director of Building Maintenance and Parks, right? It's appointed department head. There was insufficient data when you did your monthly median. The internal alignment is to recommend 15% below the airport director. So how is that, how do we interpret that? How did you come up with that? If this is our structural analysis that you did for us, where's the data that shows that this is where this should fall?
So we look at the same factors when we're making recommendations on those internal relationships as what we use when we do the job matching. So there's a section in the report that talks about all of those factors. So we're looking at things like span of control, the technicality of the work or the complexity of the work that is being performed, the reporting relationships both to whom the classification is reporting, as well as what that reporting structure looks like, the scope of the work that they have responsibility for. That particular classification was challenging in part because of the way that it's described in the classification description. And so finding a job match that that was a director level but described in that same way, we just weren't able to find those matches. And for that segment of the business where at that level, oftentimes we find that there are more business segments being supervised by that director level. So it's a little bit narrower in scope than what we found in the market. So in making an internal relationship, we were looking at finding a classification within the county structure that has some similarities in the types of classifications that they're supervising and overseeing and the type of operation that they're overseeing. To your point, that one is particularly challenging, but there is some relation between the types of work and classification that is being overseen by that director as with the airport director. And so that is where that recommendation was drawn from.
Okay, thank you.
Mm-hmm.
I had one more. I'm sorry, I wrote down a different question. On page 19 of the report, you talk about pay philosophy. And I understand the premise there, but I was just wondering if Gallagher evaluated the pay philosophies of the comparable counties. For example, like if Glenn County, if their philosophy was to pay their people 10% above market or 10% below market, is that something that was evaluated?
We didn't specifically speak to the agencies about their compensation philosophy outside of what we were able to observe within the salary schedules and their MOUs and any kind of documentation that they had around their salary resolutions or MOUs. Again, looking at how job families are paid relative to one another, looking at where they where they're paying the director as opposed to the director's reporting structure, and making those comparisons within the data set itself is where we can sort of make those observations. But in terms of how they are comparing to the market, that wasn't specifically something that was part of the scope that we asked.
Okay. One other thing just came to mind back to the control point for your calculations. You said that the county typically goes off of the base or entry level salary. Were you asked by the county, I guess, administration, or was it in the contract to start from entry level, or how do we come to the decision to start from the top of the pay scale, which it obviously skewed our results here?
So the maximum salary comparison is what our methodology includes. We did not, that was discussed early on in the project. I don't know that the connection was made to that also, then that is the comparison point across the entire study. And so after collecting the data and looking at these internal relationships and kind of looking at these structures, we had those conversations around the county's historical practice to compare at the entry step. That would not be something that we would include in any deliverables that we would put together, because really what we're supposed to be doing is giving you recommendations based on best practices, and that would not be one. And so that discussion did happen probably later in the process. You know, we might have been talking in parallels and not maybe clearly understanding when we're talking about the maximum salary, that really translates across the entire project.
Okay.
If I may chime in here, we have certainly done studies in the past where we did also look at the minimum pay at each agency, and without fail, we always find that unfortunately the minimum step or minimum of the range across a variety of agencies is so inconsistent, because each agency has a different structure, that we would never use the minimum step from our end. We would never use the minimum step to build an entire structure upon, or relationships. So if as an example, you might imagine that if one agency has a 5-step system all across the board, where the differential between the steps is 5%, that leads to about a 21.5% difference between step 1 and step 5. Another agency might have a more open range structure where you've only got a minimum to maximum, you have no steps, but the differential between min and max is 30 or 40%. So by reporting the top of the range, which gives you the maximum value of any body of work that we're analyzing, that is the most consistent point of comparison. At the bottom end, then you're dealing with different range structures. And as Carrie said earlier, especially agencies where the ranges are wider, where the bottom step is at a place that's no longer competitive with the market, a lot of agencies are kind of overriding that bottom step, and they bring people in at step 2 or 3, or they bring people in, in an open range structure, they bring people in at 10% into the range. So that really that bottom of the range is not a reliable point of comparison, number one, and it's not a reliable point to anchor an entire compensation structure on. So again, building from the bottom down is the most typical industry standard that you're going to find in most public agencies that we work with.
Yeah, thank you. I still disagree with I understand what you're saying about the top step. It just doesn't make sense when there's different pay structures inside the county. Your 4, 5, and 8 really just screwed that premise up. If it was consistent across the board, I would completely understand that top step would work, but it doesn't seem to, and we can see that by our internal overlaps that we see here, that it didn't work very well.
Okay. Judge Starkey, anything else to add?
Well, I think we've expressed at this point. I'm just curious to know from our own staff what our next steps are. I think that before we do that, perhaps I will make the motion that we receive and file this report. But I certainly don't want it going on a shelf. So I'll make that motion, but then I'd like to hear from CAO Lopez about what our next steps are.
Our next steps are essentially what we've kind of reached as a compromise with Gallagher. There was some overlap. There was some compression that was caused by the recommendations from Gallagher because of the different salary structures. And so what we're going to have to do is use the market data that was provided for the benchmarks and the internal relationship recommendations that they developed and kind of create our own master schedule internally that starts with our lowest range. I've discussed this with both of our represented groups, mid-management and SEIU, and plan to discuss it with SEA as well, so that they know what's going to happen going forward with this information. Gallagher had initially provided a complete recommendation spreadsheet that caused these issues that we noticed when reviewing it. And it was because of the 5-step, the 6-step, and the 8-step structures that were developed based on when employees could reach their maximum salary. And so in seeing those inconsistencies and the internal relationship issues it caused, our team kind of discussed with Gallagher at length over a number of meetings saying, how do we reach a common ground here and give us the information that we need to develop this internally? And so going forward, it'll just be the management team that develops this based on the benchmarks and the relationship information provided by Gallagher. Once we provide that, or once we create that master schedule and those recommendations, I'll make sure that the appointed authorities get to look at that from an internal perspective of their operations, as well as our recognized bargaining groups.
Okay.
And of course, running the cost projection, which is a big part of this.
It's the big part, yeah. Okay, we have a motion to accept this. We have second.
I'll second if we need a motion, sure.
All right, do we need a motion for this, Kylie, to accept it?
Valerie already made one. Am
I know, but
incorrect?
we do need to accept this in, correct?
Yes.
Okay, then would you please pull the vote?
Supervisor Short?
Yes.
Supervisor Starkey?
Yes.
Chair Borges?
Yes. Okay, all right, thank you, guys.
Thank you.
Thank you, everyone. Take care.
Okay, that takes us to our 11:30 timed item, public hearing on the workforce vacancies, recruitment and retention, Assembly Bill 2561, Government Code Section 350.02.3, by Carrie Vu, Human Resource Risk Management Director.
Good afternoon. Thank you for those that are here to attend this public hearing. My name is Carrie Vu, the Director of Human Resources and Risk Management for the county. I'll be presenting this presentation to address significant challenges our governmental agencies are facing regarding workforce vacancies, recruitment strategies, and the retention of our valuable employees. This hearing is mandated and structured in accordance with Government Code 3502.3. While the specific details of this code section are extensive, for our purposes today, it underscores the importance of transparency and public accountability in matters concerning public sector employment. It emphasizes the requirement for governmental agencies to regularly assess and report on their workforce status, particularly concerning challenges that impact service delivery. And I do have a significant amount of information. I'll try to get through it as quickly as I can, but I just do want to mention that what's included in this presentation is not fully comprehensive on the actions and overall review of the program. It's really the high overview, again, of the actions taken, and moving forward, there'll be additional development that will come forward at a later date. Next slide, or can I click? Okay. Perfect, thank you. AB 2561 adds Government Code Section 3502.3 to the Myers-Milius-Brown Act, MMBA, and is a pivotal piece of legislation that significantly impacts how public agencies manage workforce vacancies. The MMBA is the primary statute governing labor relations between public employers and employee organizations in California. This new section integrates vacancy management directly into this foundational act. These new obligations are not just minor adjustments. They require systematic tracking and presentation of job vacancy data. AB 2561 explicitly declares job vacancies in local government as a widespread and significant problem. This isn't just an administrative challenge, it's a declared public issue. As we know, persistent understaffing can lead to increased workload for existing staff, burnout, with cascading effects throughout public service delivery. AB 2561 is just not about reporting numbers, it's about proactively managing our workforce capacity. So the agenda for this presentation is designed to provide an update on our efforts to address job vacancies within the county. In light of the new obligations introduced by AB 2561, this legislation mandates a proactive approach to vacancy management, recognizing its significant impact on public service and employee well-being, which supports our current ongoing efforts of the county's existing planning and human resources and risk management department's tactical goals. We'll begin by diving into the county metrics, where we will present current staffing levels and detailed vacancy statistics across all departments. This data provides a foundational understanding of the scope of the challenge. Next, we'll transition to policy, procedures, and recruitment barriers. This section will involve a critical analysis of the systemic issues and existing challenges that may be hindering our hiring processes. Understanding these barriers is crucial for developing effective solutions. Following that, we will highlight the proactive steps we're taking under recruitment improvement efforts. This includes an overview of strategic initiatives implemented to attract qualified candidates and the measurable progress we've reached so far. Equally important is retaining our valuable workforce, which brings us to the retention improvement efforts. Here we will discuss programs and policies specifically designed to support and retain our employees, recognizing that reducing turnover is key to addressing vacancy rates. We will then explore opportunities to improve, focusing on data-driven recommendations that could enhance compensation and working conditions, further contributing to both recruitment and retention. This is where we consider long-term systemic improvements. Finally, at the end, a conclusion with presentations from our represented employee organization groups. County-wide metrics. You'll see here on this slide, it provides a comprehensive overview of the current staffing landscape across the county. It's crucial to establish these baseline metrics as we delve into the challenges and opportunities for improvement in recruitment and retention. Total positions for the county-wide is 482. This number represents the full capacity of our workforce if fully staffed. Our total vacancies, 121. This highlights the immediate staffing challenges we face. These positions are across various departments. This leads us to an overall vacancy rate of 25%. This is the most critical metric on this slide here. A 25% overall vacancy rate indicates a significant staffing shortage. A recent study from the UC Berkeley Labor Center found that vacancy rates are as high as 30% in several counties. For a more granular view, the table breaks down these metrics by specific bargaining units, ranging from 0% vacancy to 33.99 or 34% for simplicity's sake vacancy rates. The difference in range indicates that solutions may need to be tailored to specific bargaining units or types of positions, as one-size-fits-all approach might not be effective in addressing these challenges. I know it's a little bit difficult to see on here, so I'll kind of call out a little bit. As the titles indicate, this table breaks down vacancy by both department and bargaining unit. The first two columns identify the specific department and, where applicable, the division or branch, offering precise context for each row. The subsequent columns represent various bargaining units and the volume of vacancies. This is particularly pronounced within Health and Human Services, specifically in the Social Services branch, with 41 vacancies, the Behavioral Health branch with 24 vacancies, and Public Health with 10. These numbers are highly impactful as these divisions provide essential direct services to our community. Staffing shortages here can directly affect the delivery of vital social programs. Similarly, you'll see the District Attorney's Office has 7 SEIU vacancies, which can slow down legal processes and caseload management. The Probations Department also shows a combination of mid-management group and SEIU vacancies, totaling 10 vacancies. The Sheriff's Office, the jail unit, has 8 vacancies and under the SEIU bargaining unit. This directly impacts public safety. We also see several smaller yet important single vacancies across various departments, such as the Administrative Office, Animal Control, Assessor, and Auditor Controller. While these numbers are smaller, each vacancy represents a critical gap in a specific function, potentially impacting efficacy and the ability to meet department objectives.
Can I ask a question on this slide? Yeah. Under the Probation Department, Youth Opportunity Center, I wish the slide was back up. It is showing, is that just the Youth Opportunity or probation as a whole, and the same with the Sheriff's Department? Is it just the jail unit or the Sheriff's Department as a whole for these numbers?
Let me see. They are combined fully.
Okay, thank you.
Good question. Thank you for the clarification. Let me see here. On the positive side, you'll observe that many of these 0% vacancies show, in the detailed breakdown, reflect stability in certain roles and divisions. This indicates while we do have challenges, there are more concentrated at certain operational levels. That gives us a direction of where we need to focus our approach. This detailed data informs our strategic approach to recruitment and retention. It allows us to pinpoint exactly where resources are most needed and to develop targeted solutions, whether it's revising recruitment strategies for specific classifications, reevaluating compensation for hard-to-fill roles, as we did earlier before this presentation, or exploring creative staffing solutions. Moving into the county-wide metrics, which range from the 24-25 year, which is September 2024 to August 2025. This This chart here indicates a strong positive trajectory in our recruitment and retention efforts. You can see on this, maybe not, on the graph showing the numbers for successfully onboarding 138 new employees this year. This represents a significant 25% increase compared to the previous fiscal year, or I'm sorry, not fiscal year, the prior calendar year that we've indicated, which was September to August, where we hired only 110. So you can see the upward trajectory in the blue line. This growth is a direct testament to our enhanced recruitment effectiveness, including improved outreach, more efficient application processing, and proactive talent acquisition strategies. We recorded 86 employee departures during this period. This is a 20% reduction from the 108 departures we saw in the prior year. This positive trend indicates a marked improvement in employee retention overall. It suggests that our efforts are yielding tangible results. And you want to continue to see that gap on those lines of trajectory. Lowering turnover not only stabilizes our workforce, but also reduces costs associated with recruitment and training new staff. We did receive a total number of 1,657 applications overall. This was a fairly high volume and underscored strong candidate interest across all positions within the county. And moving forward, as we look at the broader hiring statistics, this slide provides a granular view of our recruitment pipeline. It's about understanding the how behind our numbers, where candidates are succeeding, where they're facing hurdles, and what insights we gain to refine our approach. To break down the pipeline into 3 key stages, we have applicant screening, interview process, and hiring outcomes. Our initial screening shows that 665 candidates did not meet the minimum qualifications or failed the initial screening of the total applications received. While this filters out unqualified applicants, it also highlights an opportunity. A significant number of disqualified candidates can indicate that our job postings might not be clear enough, or our outreach isn't reaching the most suitable talent pools for those positions. This isn't just about rejecting candidates, it's about optimizing the top of the funnel to attract better suitable applicants from the onset, reducing administrative burden later on, and identifying areas of opportunity. Moving further down the pipeline, we successfully interviewed 464 qualified candidates. This is a positive indicator, demonstrating a strong conversion rate from the qualified applicant stage to the interview stage. It suggests that once candidates meet initial criteria, our scheduling and interview coordination are largely effective. This is showing that once candidates are in the interview pool, we are effective at engaging them. Looking at our hiring outcomes, we created 148 eligibility lists and made 195 conditional offers. This reflects our efficiency in progressing candidates from the to the interview stage to formal offers. This indicates our internal process offers generation of offer letters, but I do want to mention also that's only the conditional offers that were extended and were accepted and started. We do have various conditional offers that are extended and for some part of the process, either a candidate declined, they didn't pass a certain part of the background check, or any other item that might have prevented them from actually starting employment with the county. And in addition, while we see successes, we also face the ongoing challenges, which I just mentioned. An additional are 85 duplicate applications, which create necessary administrative work. The 75 no-shows or unavailable candidates highlighted potential communication gaps or timing issues. And the 78 candidate withdrawals indicate we might be losing talent at various stages, possibly to competing offers or changing candidate priorities. It is important to mention that our current tracking process does not provide a breakdown in time for each process in the pipeline for hiring. And due to our recent overhaul of our system and part of our process improvement initiatives, these numbers are only based on the data we have available. This does not include outlier requisitions or new hires. Requisitions, which is essentially a vacancy for a single position. So we have one requisition per each vacancy. Any requisition that's pending on hold or otherwise was not part of a standard recruitment process. These are not included, as these will create a skewed review of our data. Part of our improvement would also be to increase the integrity of our data, so making sure that we create those pipelines and we can actually gather the critical information of the time spent in each pipeline process and being able to evaluate any areas of improvement or areas that are exceptionally challenging or that we do well that we want to mirror in other areas. Overall, understand these pipelines, the dynamics that help us focus our improvement efforts. It's not just about the numbers, but the stories behind them, guiding our strategic decisions moving forward to have improvements, not just action.
Ask a question, or do you want to wait till the end?
Your choice.
I just have a question on the application screening process.
Yeah.
Out of the 665, does, like, those were all didn't meet the qualifications, but let's say something in building maintenance or in roads, on paper, they didn't, have the right certificate or whatever, but, in reality, they had 20 years work of construction. Do the department heads get to look at any of these applications and be like, well, this person worked here for this many years, maybe this is a good applicant? Or is it screened prior, before anybody even looks at it?
The current practice for reviewing an application that's received, you look at the job description, minimum qualifications, and there's a large variety of the way those are structured, which is part of our current review to review those minimum qualifications and how they're written. But it could be indicating that you must have, this degree with as many years of experience, or it can be an equivalent combination. So looking at that process, the HR team has really looked at how we're evaluating that and how we can possibly look at that experience being qualifying in those cases that we can. Some positions, they are very specific and you have to have this specific requirement, this minimum requirement, or you don't qualify. On various occasions, there might be somebody who has applied and has maybe spoken to the department or something that's been discussed at some point. Departments will reach out to Human Resources and ask for this candidate information. We'll oftentimes review those applications with the department to determine if there's something that we were missing. It could be something as simple as the candidate forgot to add a prior year of experience or some other work experience. So we've collected that information and made it a different determination. Sometimes we don't. Sometimes it depends what that job description really states. And kind of further in here in the presentation, I'll discuss that briefly, but a lot of it is aligning our minimum qualifications with the job function, if that's accurately reflecting if they can perform the job successfully.
Okay.
All right. Bargaining, representative bargaining units. As part of legal requirements, there is a specific additional obligations may apply if the vacancy rate in a bargaining unit exceeds 20%, and that's verbatim. The 20% vacancy rate isn't an arbitrary number. It's the point in which the law deems the situation critical enough to require enhanced transparency in action. Upon formal request from the representative employee organization, a public agency must present the following comprehensive additional information at the public hearing. Although, as this is the first year presenting and the timeline we currently are under, these numbers for the 3 represented bargaining units will be provided without request from the organization themselves. Right. Mid-management group. This slide focuses on the numbers broken down as from the previous slide requires for additional 20% vacancy. I did have an error. I omitted one position, so this is actually 9% vacancy rate for MMG. I do want to reiterate that the average days for time to hire on the bottom right-hand side, it does omit outliers, which skew the numbers, and that capturing such data as part of our overall improvement efforts in our current ATSR applicant tracking system, and was identified upon initial evaluation of the hiring process and needing improvement late last year. So we've been working on addressing that need. You can see job vacancies are the total of 6 with the adjustment. Applicant interest, we've received 58 total applicants for the vacant positions, the current vacant positions, and the hiring timeline average is 65 days, and that's from job posting to an offer of employment. DNCEA, SEIU.
Would you happen to have a number on from job closing to employment? Like, is that, because I know when it's posted, then there's so many days, but how long is it from like, all right, we're closed to the interviews to whatever? Because I think a lot gets lost in that window. Do you know what that number is?
I 100% agree with you, and that's one of those statistics that we don't have clearly in our system. That's one of our large focal areas to identify those dates so we can identify how long that timeline is. Because if on average, if it's 30 days from this point to this point, then it's taking 60 days in another area, that's significant. That's obviously causing one of the larger delays. So being able to create and structure our applicant tracking system to ensure we're capturing those various processes in the pipeline is going to be really critical. Unfortunately, we don't have that data easily accessible. We have started looking at how we're going to develop that and create that so we can track it for the following year, but we're just really not at that point in the process. We have pulled various samples to see where those at, but it's truly about identifying the position, the emails back and forth with the candidates, with the departments, where that's scheduling, where's the onboarding, do they have anything pending? A lot of times you might have a candidate from outside the area, they might have to delay finding housing or other things that they're required to address prior to starting. It could be requiring a longer resignation with their prior employer. So sometimes, and we're fairly flexible, of course, with candidates' requests. So if it could be 2 weeks, it could be 4 weeks. So that really does provide really critical information, but we need to be able to track it in a way that it makes sense. Okay. So let me back to this slide here. SEIU, which is our largest and currently presents our most significant workforce challenge due to its critical vacancy rate. The vacancy rate for this unit stands at 33.99 or 34%, which are rounded for simplicity's sake. This figure is critical because it significantly surpasses the 20% threshold that mandates additional reporting. This is not just a statistic, it represents a significant strain on our existing workforce and the quality of services we provide to our community. Of the 306 total authorized positions, there are 104 vacancies in this group. We have received 1,164 total applications for these vacant positions, and the average processing time is 75 days. And that's, again, from the job posting to offer of employment. Sheriff's Employee Association is up next. As you can see, their vacancy rate stands at 16.13 or 16%. It's important to note that the recruitment efficacy does not include the extensive background requirement for peace officer standards and training. So although you do see a 36-day recruitment efficiency, that doesn't include the extensively long post requirements to conduct that background. And a total of 62 positions are authorized in the Sheriff's Employee Association, or SEA. 10 vacant positions. Of those 10, 94 total applicants have been received. Our comprehensive analysis has identified 3 primary areas where we face significant barriers. Addressing these will be crucial for any meaningful improvement in our staffing levels. Minimum qualifications, which we briefly talked about previously. We've observed a concerning trend where a significant percentage of applicants, specifically 40%, fail to meet minimum qualifications outlined in our job descriptions. This high rejection rate suggests a potential misalignment, as our job requirements may be too stringent for the current market, or are we not effectively communicating these requirements to potential applicants? There's a variety of questions to really delve in and identify what these issues are. In the majority of the time, it's not one in particular, it's a combination. But identifying the highest trending and addressing kind of top down. This necessitates that critical review of our current minimum qualifications, which is underway in many areas. The technology limitations, I can't emphasize enough, our current applicant tracking system was creating a significant bottleneck. While it processes applications, its efficacy is limited and its data tracking capabilities are insufficient. The ATS constraints directly impact our ability to efficiently process applications, leading to delays and potentially losing out on strong candidates who might accept other offers due to our slow response time. We have made much improvement, but is still being evaluated and continues to improve almost daily. More critically, the lack of robust data tracking prevents us from generating comprehensive recruitment analytics, as you can see here. We can't effectively measure our recruitment funnel, identify where candidates drop off, or access the success of different recruitment strategies without this data. This truly hinders our ability to make data-driven decisions, so it's top priority to get our applicant tracking system running effectively so we can capture this information. The third item on here is the merit position bottleneck. A particularly acute challenge lies within this merit-based positions. Of the 117 classified merit positions, 45 are currently vacant, representing a significant 38% vacancy rate. To put this into perspective, these 45 vacancies account for 41% of all vacancies within the SEIU bargaining unit and 20% of MMG vacancies, highlighting a specialized and persistent recruitment challenge for these roles. Merit positions often require very specific skill sets or certifications and are managed by merit, making the talent pool smaller and recruitment inherently more difficult. This high vacancy rate is critical. Merit positions can have a ripple effect, increasing workload on existing staff and potentially impacting service delivery again. Policy, procedures, and improvement solutions. This slide highlights tangible solutions the county is implementing to address these recruitment and hiring barriers. We are not just identifying problems, we are actively building strategic frameworks and operational improvements. The overarching theme here is systematic and holistic approach to transforming our recruitment landscape, not just making minor adjustments. Listed of the four on the slide here, county strategic planning. This is the foundational element of our efforts. We're moving beyond ad hoc responses to a truly comprehensive workforce planning initiative. This plan creates a framework to establish clear objectives, measurable outcomes, and accountability structures. It's about setting a clear vision for where we want to be in terms of talent acquisition and retention across all departments. Human Resources Department Development. A strong HR department is the engine of effective recruitment. The first face any candidate sees, that working through the hiring process and getting those candidates to that table for onboarding for that first day of new employee orientation. It was recognized by the county that the HR department needed capacity enhancement. The solutions focused on dedicating resource allocation and structural improvements within HR. Within just the last year, actionable items include reorganization for functional and specialized staff, developing improved training programs for our hiring managers and HR personnel. This shift is to create HR as a strategic partner in our recruitment process, not just transactional. Compensation study implementation. One of the most direct ways to attract and retain qualified candidates is through competitive compensation. As we discussed in the prior item this morning, compensation study has been in progress, is in the works. Policy and procedure development. Streamlining our processes is critical to improving the candidate experience and operational efficiency. This involves a systemic review and modernization of our recruitment policies. We're focusing on creating streamlined hiring processes, updating qualification standards, such as the minimum qualifications, and developing internal standard operating procedures upon finalizing evaluation of our existing practices, and continue to work on the development of a comprehensive HR policy and procedures with an employee handbook. These four solutions, while distinct, are all interconnected and form a cohesive strategy to build a more robust and effective recruitment ecosystem for the county as a whole. They are designed to provide both immediate improvements and long-term sustainability of our practices. All right, diving back into recruitment improvement efforts. This slide is a visual representation of the immediate impact of our updated recruitment strategies, especially in the digital realm. The core message is that our targeted online presence has dramatically increased the visibility of our county employment opportunities. We have over 100,000 views on our applicant tracking system. This is not just a high number, it represents a potential candidate reach. More views translate directly to a larger, more diverse pool of applicants, which is crucial to filling critical roles and ensuring we hire the best talent available. It also identifies and signifies increased brand awareness for the county as an employer and where we can improve. We're still gathering data on hard-to-fill positions to enhance our platforms that are effective in reaching targeted talent and pools. Moving along here with recruitment improvement efforts. This slide here outlines core components for our comprehensive recruitment strategy. Building upon the previous discussion of increased job posting views and digital outreach, it answers the how behind our success. We are developing a multifaceted approach through these various items: digital platform optimization, social media engagement, community partnerships, and targeted recruitment events. We're working directly with departments to identify those as well for certain professions as needed. And as we delve further in our strategic marketing campaigns, we want to rely on accurate recruitment data. We will be able to narrow down a more effective action plan. All right, job posting views. These two graphs show a really important piece of data that we were able to collect from our applicant tracking system. And it shows us our measurable outcomes of these strategies that we're discussing. Here we present a crucial comparative analysis of our jobs year over year, so 23-24 to 24-25. You can see a fairly large increase in growth. This improvement demonstrates the measurable impact of strategic investment in recruitment technology and our outreach initiatives. And this isn't just about throwing resources at a problem. It's about being smart and strategic, investing in technology and outreach that yields clear, quantifiable results that we can measure. This directly correlates to the previous slide's point about optimizing digital platforms and expanding social media engagement. Retention improvement efforts, let me see here. Our biggest focus here isn't just about keeping people in their seats. It's about building a culture where employees feel valued, supported, and see a clear path for their professional growth within the county. High retention rates are a direct indicator of a healthy, productive, and desirable workplace. We understand that talent acquisition is only half the battle. Retaining our valuable employees is paramount for continuity, knowledge preservation, and sustained growth, especially in our very rural and limited area. From employee recognition programs, we believe that acknowledging and appreciating our employees' hard work and dedication is fundamental to building a positive work culture. Recognition goes beyond just compensation. It's about making employees feel seen and valued for their contributions. Employee anniversary recognition programs, we are currently working on a program to celebrate key milestones, such as 1, 5, 10 years of service and beyond. This includes personalized recognition from leadership. Employee events, these are truly more than social gatherings. They are strategic investment in team cohesion and workplace culture. From team building activities to celebrations, these events foster camaraderie, reduce stress, and allow employees to connect on a more personal level, strengthening their bond with the county and their colleagues. And the last one on this slide here, employee wellness programs. Employee well-being is directly linked to productivity, morale, and retention. A healthy workforce is a happy and engaged workforce. Our programs address both physical and mental well-being. We've invested in specialized resources to help employees navigate the complexities of their benefits. This coordinated position, which is a new dedicated HR benefit coordinator, will be providing personalized guidance, answering questions, and ensures employees fully understand and utilize their comprehensive health, retirement, and other welfare benefits. This reduces the frustration and ensures employees feel supported. We've been working on collecting all available such benefits through our insurance pool group. Roughly 4 to 5 programs that were available that weren't previously communicated, we've consolidated and partnered with PRISM, which is our insured pool group, to collect that information. And we've been communicating that to our employees when we receive that information. And our to-be-determined upcoming health fair will have a comprehensive breakdown with information on all of these programs in one location, centralized location. Comprehensive health and welfare benefits. Beyond the coordinator, I'm sorry, I skipped over a section here. Safety coordinator, we also restructured the HR risk management department to also include a safety coordinator. Truly, proactive safety is non-negotiable. Our dedicated safety coordinator works on implementing rigorous workplace safety programs, conducts regular training, and ensures compliance with all regulations. This will demonstrate our commitment to providing a secure and healthy work environment, which is particularly important, especially in certain operational roles. Both of these roles have been filled recently, so we have a lot of development and a lot of really exciting programs we'll be rolling out in the next year. Comprehensive health and benefits. Beyond the coordinator, we continuously review and enhance our benefit package to remain competitive. This includes our medical, dental, vision coverage, mental health support, and other wellness programs that we can offer. And we have been developing additional policies that are still in the works that hopefully we can announce here in the coming months. I think I might have skipped over one on that. Are you able to help me go back one slide? before I click on anything else. Thank you very much. I actually omitted to review the very last column here on the side, specific about process improvements. This really, one of the largest areas we've identified is lack of clear communication, and that directly impacts employees being satisfied in their processes and being available to really empower our employees and show respect for their time. The streamlined procedures, this involves optimizing internal administrative functions such as HR requests, expense procedures, or internal approvals. The goal is to reduce bottlenecks, minimize paperwork, and ensure requests are handled efficiently and transparently. Working on implementing new software and revised workflows to achieve this reduces employee frustration and freeing up the time for core responsibilities. The right time communications, this is really critical. We've moved towards a more strategic approach to internal communications, ensuring employees receive relevant updates, policy changes through appropriate channels at opportune moments. This reduces information overload and ensures critical messages are heard and understood, fostering a sense of transparency and inclusion. This is also going to be in as kind of a core function of our new employee orientation restructure program. Enhanced support and guidance. This includes investing in leadership development for managers, focusing on coaching, performance feedback, and empathetic leadership. Right. Now we're going on to the next slide here. Opportunities to improve compensation and working conditions. And this is part of the additional requirements for vacancy rates at over 20% for bargain units. So this is comprehensive for all county positions. As we've analyzed the current landscape and retention efforts, it's clear there are significant opportunities to further strengthen our workforce. This slide outlines our strategic approach to enhancing compensation and working conditions. We're looking beyond quick fixes to implement solutions that are data-driven and genuinely employee-centric, ensuring we meet both immediate needs and foster long-term career satisfaction. Of the pillars here, data-driven solutions, this isn't about guesswork, it's about precision. We propose a systematic approach to identifying where our greatest opportunities lie. This involves deep dives into our retention patterns, understanding why employees might be leaving through comprehensive exit interview data, and critically benchmarking ourselves against the market. We need to know what competitive compensation and benefits look like in our industry and region to inform our policy decisions. Employee feedback systems. Beyond just collecting data, we need to actively listen to our employees. Comprehensive employee surveys will be critical for identifying cultural strengths and areas for improvement. A significant shift we propose is focusing on stay interviews versus just exit interviews. Instead of learning why someone left, we want to understand why our valued employees chose to stay, what keeps them engaged, and proactively address any concerns they have before it escalates. And the last one here is career development framework. Employees today seek more than just a job, they seek a career path. This pillar focuses on evaluating and significantly enhancing our professional development opportunities, clearly defining career advancement pathways and strengthening our strategy for succession planning. This goal is to create transparent growth trajectories to all employees, demonstrating that we have invested in their long-term success with the county. These are truly not vague ideas, but concrete areas of investment and focus that we can support in various ways. Okay. With that being said, that brings me to my last slide and the end of the county presentation. And at this time is now for the representative group presentations. And we do have MMG and SEIU that had elected to present after my presentation.
Great, thank you.
Thank you.
Let's come down first.
Hello. Get my notes out. Good afternoon. My name is Samantha Regan. I'm the compliance manager for the behavioral health branch, and I'm the vice president of the mid-management group. I'll be reading a letter prepared jointly by the officers and negotiation team of the mid-management group, which includes Christina Smith, Irene McLennan Moreno, Jessica King, Josh Glazner, and Lisa Hereford. To give some background, we are currently a group of 66 positions. Mid-management is classified as separate leadership positions due to the higher level of accountability and operational tasks. The HR director's report states that the mid-management group represents critical leadership positions across all county departments. Mid-management members are responsible for overseeing workflows, special programs, fiscal operations, maintaining state compliance, dissemination of information, payroll, auditing, claims processing, and upholding state codes and laws, including the health and safety code, employment law, building standard codes, emergency response, and various other codes that our local county government is entrusted to follow, along with various other critical functions that keep the countywide workflow moving. We are concerned about the inconsistencies in the data presented, which Mrs. Vu mentioned previously. Lists 5 vacancies in our mid-management bargaining unit, primarily in child support services and community development, while page 5 lists 6 vacancies across multiple departments. Additionally, the membership list provided to us included 61 employees, though 2 of them have been confirmed as not part of our group. Based on our review, there are 59 filled positions, leaving 7 vacancies total. Over the past several years, the role of our members have evolved dramatically. We are no longer simply completing daily tasks. Our responsibilities have expanded to include tasks previously handled by senior leadership. We act as a bridge between the department heads and assistant department heads and frontline staff. We perform these new duties with diligence. It should also be noted that the high rate of vacancies in the SEIU group affects our group daily as we fill in for those vacant positions as well. We've been waiting the results of the salary study for several months. We understand that there are delays in these types of reports. However, the county has done several countywide salary studies in the past, and we've never implemented raises based on those studies. Our group has not received a cost of living adjustment in 2025, while other groups have received an increase. We last negotiated our MOU with the county and the understanding that the salary study would be done and implemented by the end of our extension, which was June of 2025. The cost of living in general has steadily increased, and yet wages have not kept pace. Our members are doing more with less, while the county continues to rely on our commitment and maintain essential services. SEIU has received a well-deserved 2% increase in September 2024, with an additional 5% increase in March 2025, totaling a 7% increase within a 6-month period. SEIU workers are now earning as much or more than mid-management at entry level, even though managers have more responsibility. Without action, managers are making less than the people they supervise. This situation is not equitable and is bad for morale. It sends a message that leadership work isn't valued, which leads to frustration and burnout. As exempt employees, we've historically received 1 additional week of vacation compared to line staff as a small recognition of the added responsibilities, longer hours, and lack of overtime compensation that comes with our roles. With the recent increase in vacation for line staff, that benefit has been erased. If the county is looking for retention from their employees, they need to compensate employees for their workload, expectations, and stress of the job, and reward the loyal employees that have been here for an extended period of time. Per Ms. Vu's report, our group has relatively stable staffing levels compared to other bargaining units, which shows the dedication of our members. This board has time and time again agreed to start new employees at higher steps than the steps we all had to work through several years to reach. These things hurt morale across our entire group, which affects every department. Through each round of negotiations, our group feels the benefits of being in the mid-management group have continued to decrease. To quote the executive summary of the Gallagher compensation study, the concern of the Board of Supervisors and management is that employees should be recognized for the level and scope of work performed and that they are paid on a fair and competitive basis that allows the county to recruit and retain a high-quality staff. The mid-management group fully supports any and all efforts to raise wages and other benefits for all of our members. While we understand structural compensation reviews can take time, delaying further only deepens the inequity and reinforces the message that the mid-management group's contributions are undervalued. We are committed to working collaboratively, but the delays are detrimental to morale, retention, and the equitable treatment of mid-management employees who continue to meet the needs of the county without the compensation or benefits to reflect it. We would like to see that a wage adjustment, cost of living adjustment, and additional benefits for the entire mid-management group aside from the corrections that will be made as a result of the salary study. Thank you for your time and attention. I also have 3 letters from different people in our mid-management group. They were not able to present today, and partially some of them didn't want to present in front of everyone.
Sam, can you email us a copy of what you just read?
Yes.
Because I tried to diligently take notes, but I wanted to make sure I have a hard copy of it.
Yes,
Thank
I
you.
will.
And yeah, if you would give those to Kylie, maybe she can make copies and make sure we get them all as well.
Perfect. Thank you.
Thank you.
Time this on a stopwatch, so hopefully I can get it done in time, since we have the 10 minutes. First off, we want to thank the county and HR for giving us this opportunity to provide feedback on the 2 presentations made today. Many departments are experiencing high vacancy rates, which are attributable to several linked causes: low wages, high workloads, and high personal costs in terms of health care and basic living needs. The county's finalized compensation and classification study bears this out, with many positions being identified as 10% below market. The raw compensation data supplied by Gallagher in June already showed that 85 out of the 160 classifications surveyed were from SEIU. On average, 45% of those surveyed were under the market average. We estimate that overall salaries for SEIU-only classifications are 10% below average against the comparator counties. In 2016, the CPS HR Consulting Final Base Salary Report noted overall county salaries were 10.83% under market median. In 2022, the Collective Good noted an average of all county salaries were 11.65% under market median. Not a stellar trend despite negotiated increases to salaries and benefits. Gallagher says that they consider 5% below market as close enough. 5% below market is not at market. In fact, just being at the median means that half the people doing the same job at other counties get paid more. Del Norte should aspire for more than mediocrity. If I go to the grocery store and try to pay 5% less than what the groceries are worth, the cashier doesn't say, good enough. We urge the board to move all employees up to the full market wage. On page 15, Gallagher discusses how the total compensation numbers change when you take out the healthcare costs. Unfortunately, Del Norte has an expensive, low-quality health plan. Copays are high and quality is poor. Employees are forced to travel long distances to see a doctor. Even Gallagher recognizes this, and I quote, "While the county-paid health insurance premiums dramatically improve the county's competitiveness in the labor market, it is worth noting that there are qualitative aspects of health insurance benefits that are not captured in a quantitative analysis. Factors like quality of coverage, selection of providers, and out-of-pocket expenses for copays, prescriptions, etc., can affect employees' perceived value of this benefit. If employees are encountering substantial out-of-pocket costs, limitations in coverage, limited selection of healthcare providers, etc., the county's benefits package may not be perceived as competitive in the market as the quantitative analysis would indicate. By excluding health insurance premiums in the total compensation calculation, the county is 6.8% below the market median overall, which is only a 3.2% gain above base salary. Regardless of whether it's above or below, county employees only see one thing. Their take-home salaries don't cover their out-of-pocket premiums and travel expenses to access even basic preventative health care. We think that the board should keep their focus on the base salary comparison and not wade into trying to compare the range and value of various benefits. Factoring in the cost of benefits unfairly penalizes the lower-paid employees since the benefit costs make up a higher percentage of their compensation. Plus, we pay into it. On page 19, in the last paragraph, Gallagher recommends Y rating classifications that are over market, which means no equity or cost of living increases until the market numbers catch up. This will be a non-starter with employees in those classifications. They will perceive their pay shrinking as the cost of living increases. It is important that we get an across-the-board COLA for all employees, even if that means stretching out implementation of the equity increases. Here are examples of the Gallagher compensation analysis of SEIU positions that are below market. Deputy Probation Officer 2, 10%. Deputy DA, 10.4. Certified Public Health Nurse 1, 12.6. Account Clerk 2, 13.5. Office Tech 3, 17.5. Social Services Supervisor 1, 20.1. Eligibility Specialist 2, 24.2. Client Support Specialist 2, 23.3. DA Investigator 2, 27.1. And this is going to shock you. Behavioral Health Program Coordinator, 36.6. The board needs to act on this matter. The first step is to address the substandard salaries by moving positions to market rate. Then the board can identify what funds each department must recruit for and fill additional positions. While recruiting additional staff is important, retention of experienced and seasoned staff is more important. Currently, we are in negotiations with your team, and we are interested in working with the county to address the linked issue of high vacancies and below market salaries even after negotiations are concluded. In regards to vacancies, the average county vacancy rate was 25% with 121 vacancies. For SEIU, this number is 34% with 104 vacancies. In the merit positions, 45 are vacant, of which 41% are SEIU vacancies. At the August 4th and 5th budget workshops, several general funded departments noted that they, for the most part, are fully staffed. Others, however, were not. Probation noted an average 33% vacancy rate despite an uptick in recruitments. In the DA's office, you have roughly a 60% vacancy rate among deputy DAs. Even in the county's largest department, DHHS, their May-June 2025 report noted that the average current vacancy rate at that time was 36%. It should be concerning to you that vacancies exist not only countywide, but in key critical departments that offer crucial services and programs for the health, benefit, and safety of our community. What should also concern you are the 75 no-shows for scheduled job interviews and 78 candidates who withdraw their application during the process. The numbers given to SEIU as of 9/5/2025 tell a somewhat different story. 615 applications accepted interviews, out of which 64 withdrew, 20 no responses, and 20 no-shows. Even out of the 129 who accepted offers, 64 withdrew. These figures, however, do not tell you how many voluntarily left during their probationary period, either because of the low take-home wage and or the inability to find affordable housing to meet their salaries, among other high costs. Some cite the lack of medical providers, shopping options, and other amenities as additional reasons. Our beaches, rivers, and redwoods may draw them here, but it's not always enough to keep them here. We recognize the efforts the county and HR are making in streamlining the overall hiring process and in utilizing social media and other avenues for recruitment. We also agree that the county, and especially departments, should continue recognizing employees for achieving longevity milestones and for excellence in their public service. These efforts are nice touches, but only go so far in making employees feel valued. Comprehensive employee surveys or stay interviews will only tell you what's been known for years. County employees are overworked and underpaid. The kudos, awards, and recognitions are great, and employees love a pat on the back, but it only lasts for a moment until the employees receive their next paycheck and reality sets in, and they're faced with stretching their take-home pay over the next 2 weeks. All the recognition and awards won't make up for low pay and struggling to make ends meet. Since the county is not offering a living wage, they cannot attract sufficient applicants. This leads to key departments being short-staffed and current employees having to take on excessive caseloads or unsustainable levels of responsibility. As much as you complain about mandates, and so do we at times, we are still obligated to provide these services to our community. We're expected to do more with less, and it's going to get harder with anticipated cuts in federal and state funding. Also of significance is that the county is failing to draw state and federal funds that could be used to address the salary issue. It is also failing in creating its own revenue to address this and other funding issues. This is depriving Delaware County of the resources and staff that would expand services and provide residents with vital assistance. Fortunately, the board has the opportunity to address this situation immediately. The union is already looking into ways in which the county can access and generate revenue. As I told you before, the union is willing to work with you on this. All you got to do is ask, and we'll be right there. In the end, what matters is our workforce, the county employees who dedicate themselves to this community through their tireless service and dedication. We are part of this community. We live here, worship here, shop here, raise our families here. We are just as much invested in our county as you are. We simply can't do it on what we're making now. You say it's a revenue problem. We say it's low wages. County employees simply say it's our pay, and it's simply not enough. Not compared to other counties, to other employers. Definitely not enough to pay the rent or mortgage, utility and medical bills, fill up the gas tank, buy groceries, clothes, school supplies for the kids. The union will continue to fight and negotiate hard in response because we are dedicated to the employees who we serve. So should you. You should have that same passion and dedication. In the end, not only will our county team win, but so will our community. Thank you.
Thank you. I guess I'll open it up for public comment.
Too long. Well, a lot of words, a lot of numbers, but you still have a 25% vacancy rate. And I don't know, you pat yourself on the back for the benefits package, you're 10% below market value. What I can say is the benefit package isn't going to pay to buy a house for an employee. It isn't going to pay to even buy a car or a refrigerator or stove. And too many of your employees find themselves in that kind of a position. You're a 20-year-old recent high school graduate that has 2 years of community college. You're thinking about, a lifetime occupation. County has a job that you might be able to aspire to. You might be a lifetime employee, but after you worked a few years for the county and you realize that, you're basically barely making your average expenses on a monthly basis. You're not making any progress towards your lifetime goals. The benefit package isn't helping you much. The 10% below market value is killing you. And I don't believe for a minute that the 10% below market value is an accurate reflection of what employees in California face this day and age. I think the gap is significantly more. You take representative counties around California and you try to tell us that that's what you're going to compare to, but I know for a fact that people can go to other locations in California and make a whole lot more money than we make here in Del Norte County. I mean, I'm not an employee of the county, but I lived with one for 25 years, and the consideration for your county employees is abysmal and should be changed dramatically if you're going to improve any kind of retention and vacancy rate in this county. You just can't keep going the way you're going. I know you're up against some pretty severe competition, but you're going to have to step up your game. Thank you.
So, good afternoon, members of the board. My name is AJ Myers-Lokovich, Fiscal Officer 1 in the Auditor Controller's Office. This coming January marks 20 years of service to Del Norte County. I started as an account clerk 2 in Health and Human Services, worked my way up to administrative analyst, transferred to behavioral health, and later moved to the auditor's office. I've held multiple positions, each with growing responsibility, and since 2012, I've been in mid-management as an exempt employee. In those years, I've worked countless extra hours because it had to get done. No overtime, no comp time, just commitment. That's how it works in mid-management. 3.5 years ago, I stepped into the property tax manager role when we lost our previous one. I was approved to bring back our retired property tax manager who previously trained the one we just lost. Thankfully, she agreed to come and train me, so thank you, Patty Murray. At that same At the State Property Tax Managers Conference, I was told it takes 5 years to learn the job. I laughed until I realized they were serious. Now, almost 4 years in, I can understand what that comment truly meant. But lately, it's hard not to feel like mid-management is being left behind. In the most recent negotiations, SEIU received a 2%, 5% raise. Mid-management received 5%. SEIU got an extra week of vacation. Mid-management did not. SEIU earns overtime after 8 hours. Mid-management doesn't. And that is why we were originally granted that extra vacation week. I do want to thank Chairman Borges for delaying the conversation about board raises. That showed awareness and respect. I hope that the same care is extended to the employees across all groups, especially mid-management. If we keep focusing on recruitment over retention, we're going to lose the people who have already shown their loyalty. I'm not here to divide. Small counties like ours have to stick together. From admin to mid-management to every employee. I want to keep serving this community, but we need to feel seen, respected, and treated fairly. Thank you, guys.
Hello. I am Donna Rushing. I started with the county November 20th, 2005. It will be 20 years in just a couple of months. I didn't write anything. I wanted to talk from my heart. I want you to see your loyal employees. In this 20 years, how many outside jobs have I applied for? 1, because I am loyal to the county. I want to be with the county, and I want to know that the county appreciates the hard work that I do. You guys used to do appreciation dinners. Those were great. It stopped. It was a little bit of, hey, we see you, we appreciate you. And personalized recognition would be great. SEIU had said that only goes so far. We want to see it in action as well. You can say it, but then we want to see it. I want to see the board recognizing the mid-management group and the hard work that they do. We want you to bargain in good faith. We need something. As you guys stated earlier, I appreciate your guys' questions that you had for the comp study. They were great questions because those were questions that we had as well. It's going to take a while. You guys have to sift through it, build your own process and system. And what are you going to do? We need to see something now. We can't wait. We need to be brought up and showed that you appreciate us, that you respect us, and that you understand that we deserve more. And I just want to ask for that. I am one of your loyal employees. I do plan on being here through retirement. I hope I do not have to go and find a more competitive rate. I remember when I started in 2005, it was hard to get a job with the county. This was a competitive employee. Everybody wanted to work for Del Norte County. And I got in that position and I felt like the luckiest person in the world. And I worked my way up and I showed my loyalty. So I hope that you guys can show it back. Thank you.
Thank you.
Hopefully I'm not interrupting anybody else. Hi. Well, there's like two big things in the benefits. One's the one I want to touch on first because it overlaps what we were just discussing earlier about the approach that they're always doing treatments. So our benefits that are medical is for a disease management system. So if you're someone that's healthy, and a lot of people that are entry level, they're not really seeing that, are also relatively healthy, so they're not really getting those benefits. So there's a huge amount of money that the county is spending on that. That's out of your budget, right? That isn't really meeting the employee where the rubber hits the road. So that's a huge problem. I'm advocating for Sutter Coast Hospital to have an integrative health clinic out here. They have them in Santa Rosa, Sacramento, I think San Francisco, there's like 4 or 5 of them. And integrative health clinics at Sutter Health are holistic approach. So they're really about health. So, and you got to look online to find out what I'm talking about, but it's lifestyle medicine. It has to do with your basic needs, how to meet them, stress reduction, getting care like physical therapy and massage and alternative stuff like that, acupuncture, instead of pushing pharmaceuticals and the disease management, which is, oh, I don't have time for you. The doctors don't assess people. They give them a pill, they're out the door. And then you get snowballing ill health, right? Disease management. So anyway, I just got to put that out there. So if you guys want to get more money and more bang for your buck, have public health, DHHS, push back on these policies, have them help with the community health improvement plan to get our local medical providers to grab onto lifestyle medicine so that we can actually have a healthcare system, a wellness mindset. And then as far as like what I'm hearing with first of all, shout out to mid-management. I feel you guys, really I do. So what I would suggest is performance incentives to, first of all, to speed up salary steps. So if you're bringing in people and and you have a performance incentive and they're coming in on a lower one, but they're clearly above, you should have some sort of an incentive there where you can raise them up faster instead of having it be only time. Okay. And then another one is if you're having a scope increase, I'm calling it a scope bonus. So like for mid-management, if they have a lot of vacancies below them and they're filling in, there should be a scope bonus incentive that's like temporary based on vacancies below them. So that's not something that's a permanent thing, but they're getting compensated for that extra work. So that's something quick that you guys could do. I have a lot of other ones. I can circle back with Carrie. By the way, I like Carrie. I talked to her months ago. And we talked about some of these things, like instead of waiting for exit surveys, doing the how are you doing surveys trying to find out if there's a problem and fixing it before they leave. And there's a lot of other good stuff. I also want to bring this back up really quick. So in that report, the opioid plan that you guys put, and
I'm
you have.
Sorry, we can't keep going back to this. We've already did public
I just
comment
want to say
and
really
you're out of time. I'm sorry. I have to cut you off this time. I always try to let you finish, but now you can't go back again.
Okay.
Thank you. Okay, if there's no other public comment, I am going to officially close it. Bring it back to the board for any further discussion, comments.
No, Carrie, appreciate the work you put into this. It was good to see the numbers. We get the general idea, but seeing the numbers was kind of enlightening. So appreciate you and the other groups for coming and talking to us as well.
Yes, thank you, Carrie. Look forward to making progress on this and
making some changes, hopefully.
How often do you need to come forward to us now? Is this a mandated every year?
As
Okay.
long as we're above the 20% vacancy, is that what I got out of it? Or is it once a year forever? Gotcha. Okay. Nothing else? Thank you very much. And then we will move on to our last item, I believe. Legislative and budget issues, number 26. Approve and authorize the chair to sign a letter to the governor requesting his signature on Delaware County's sponsored legislation AB 1014 as requested by Assembly Member Rogers.
Move to approve.
And I'll second. So everybody knows this, we've talked about this before. This is the legislation that's put out to try and give some more local control to our speed limits in various areas of the county, specifically Hyuchi and Gasky is what the aim is right now. So.
Okay, we have a motion, we have a second. Any public comment? Okay, seeing none. Kylie, would you pull the vote?
Supervisor Short,
Yes.
Supervisor Starkey.
Yes.
Chair Borges.
Yes. And with that, we are adjourned until our next meeting, September 23rd.